Can y'all hear me?
Yes.
Good afternoon. I'm Armando Cuellar Jr., President of the Weslaco ISD Board of Trustees. On March 16, 2020, Governor Greg Abbott granted a request by Texas Attorney General Ken Paxton to temporarily suspend certain open meeting law requirements to the extent necessary to allow telephonic and video conference meetings in response to COVID-19. In accordance to the law, notice of this workshop of the Board of the Weslaco ISD Board of Trustees has been posted online for at least 72 hours. A quorum is not required to attend the board workshop. However, board members may attend this workshop in person by use of video conference or via telephone. The board is utilizing Google Meet for the meeting or this meeting and telephone transmission, which allows two-way communication for members of the public during public comments portion of this agenda. This workshop is being broadcast live online. As we would at any in-person workshop or meeting, members of the public who have followed the instructions on the agenda for registering for public comments will be called at the telephone number they have provided to speak up to 5 minutes. A recording of this workshop is being made and will be available to the public on the district's website. We ask for your patience for any unforeseeable technical difficulties. Today is November the 30th, 2020, and the time now is 5:42, and I call this workshop to order. Board members present, we have a full quorum, although quorums aren't necessary, but I'm going to call their names out. Present are Mr. Isidoro Nieto, Mrs. Jackie Sustaita, Coach Jesse Trevino, Dr. Jaime Rodriguez, Mr. Mark de los Santos, and Mr. Andrew Gonzalez. Okay. Public comments. Do we have any?
We have one. I'm connecting right now.
Okay. I need Carlos to come and help me with something here.
Speak.
Okay,
Hello?
I have it now. The name of the person is?
Mr. Edward Mejia.
Okay, Mr. Mejia, I'm going to read something here to you. Pursuant
Go
to
ahead,
the
Mr. Board President.
Okay. Pursuant to the Texas Open Meeting Act, the Board of Trustees may not deliberate on any comment made by a member of the public on a subject that is not included on the agenda posted with notice of this meeting. As per the Texas Attorney General, the scope of board discussion for a subject not part of the meeting agenda is limited to only a proposal by a board member to place the subject on a future board agenda. Specific factual information or recitation of existing policy may be furnished in response to inquiries, but the board shall not deliberate or decide regarding any subject that is not included on the agenda posted with notice of the meeting. Audience participation at a board meeting is limited to the portion of the meeting designated for that purpose. At all other times during a board meeting, the audience shall not enter into discussion or debate on matters being considered by the board unless recognized by the presiding officer. No public comment presentation shall exceed 5 minutes. Any disruptive behavior by any speaker may result in the speaker's removal from participation in the meeting. Please be mindful of using names or personally identifiable information, as there is no immunity from defamatory comments while participating in public comments. State your name and address, please.
Yes, sir. Mr. Honorable Board President, my name, of course, as all of you know, is Mr. Edward Mejia, and my address is 721 East Torito Street here in Weslaco for the past 33 years of my life.
Thank you. Mr. Gonzalez, you?
Here in the great city of Weslaco.
Okay. Yes. I need a timekeeper. Okay, Coach? Mr. Trevino will let you know at the 4-minute mark that you have a minute left. You may proceed.
All right, Honorable Mr. Board President, members of the board, or Madam Superintendent Canales, hope all of you are safe and in good spirits. I'm going to go ahead and defer my public comment, Mr. Board President, if I have your approval, to your next regularly scheduled board meeting. But I will leave you with this sentiment that, pursuant to your agenda item and your scheduled workshop currently, that you all do what is in the best interest of the school district and the kids, as my nephew will be one of your upcoming students attending our great school district. So hopefully whatever you discuss and whatever us, the constituents, are able to view right now via the conferencing online is, as I mentioned, in the best interest of all Weslaco ISD students and employees. So again, with your permission, Mr. Board President, I will defer my ongoing comments to your next regularly scheduled board meeting.
Thank you.
Thank you. Have a great evening. I appreciate it. Bye-bye.
Okay. Do we have any more public comments?
Mr. Martinez, do we have any more?
No more comments.
No more comments. Thank you. Now we go to item 3, COVID-19 procedures, policies, and guidelines. Dr. Canales?
Board of Trustees, good evening, and to our principals and our directors, good evening to you too. I hope everybody had a wonderful Thanksgiving break. Thank you for calling this important workshop. COVID-19, the pandemic continues not only in our area, but across the state of Texas and the nation. Every single day, there's prayers and hopes that we do have a vaccine, because all of us, I know that, I see it in the faces of students when we visit classrooms, on our teachers and our administrators, that we want our normalcy back. So until we have that normalcy back, happy about this workshop so we can discuss some very, very important items. I'd like to begin the presentation with just an overview, President Goyad, and then just go to questions that you and the Board of Trustees may have about specific items. We've got a lengthy presentation. Mrs. Taita, it was part of what we shared with you last week. It's just too much. You know, I know that there's probably some pieces that are more important to you as trustees, not that they're more important, because everything's important that we want to talk about this evening. So if I may, I'd like to start with the presentation and just ground us in where we are, because the leadership and the operations of school districts has changed drastically with this pandemic. And Weslaco ISD does not operate in a vacuum, all right? So if we can do the presentation, Mr. Martinez, and just go to the second slide. And the second slide, if it's up, it's the decision-making process. So what has happened to school districts as we faced a pandemic? There was a time when there was basically 3 things we had to look at. And many of you have been coaches, and many of you have been teachers, so we all know this, Board of Trustees. It was, what does TA say about what it is we have to teach, which is our state curriculum, about the way that we need to honor funding from the state and the federal levels, and what does UIL say when it comes to providing our children the rich experiences that we offer in Weslaco ISD through the fine arts and athletics and academic competitions. This year, everything changed. And I'm saying this year, but I'm going back to March. March, our lives were disrupted. They changed completely. We went to spring break happy, hoping that we wouldn't have any cases in the area. And before the end of spring break, on March the 20th, on that Friday, we had a board workshop. Well, we had a board meeting to take some action. So now for the decision for school districts, it's not only the United States government providing the lead for schools across the nation, it's also the office of our Texas governor. Governor Abbott and his team have a lot to say. It's the CDC now, the Centers for Disease Control, who are involved, providing us guidelines, and the guidelines have changed as our medical experts have learned more about the virus. Then we have the Texas Education Agency, who's come from a lot of curriculum and instruction and athletics and extracurricular activities, all that to now public health, safety. It's TASB, the Texas Association of School Boards, who provides guidance to our board. It's UIL, and it's the County of Hidalgo, Texas. All these entities are now involved somehow providing guidance, providing advice, providing requirements when it comes to us moving forward as a school district and making decisions. And hopefully this is just for the 2020-2021 school year. So I wanted to ground us in that. And on the next slide, even when our experts in Hidalgo County have made decisions about when school should start, the governor's office and the Texas Attorney General has come out with others, like, no, you don't have that authority to make the decisions. It's the state of Texas that does. So that's on the second slide, where there was a question from the Texas Education Agency back on July the 28th, which just asked, my district was subject to a blanket closure order issued by my local health authorities. For us, it would be Hidalgo County Health Department. Will solely remote instruction be funded for the time period of the order? No, the Texas Attorney General issued a guidance letter on July 28, 2020 that stated that the local health authorities may not issue blanket orders closing all schools in their jurisdiction. The guidance letter further provided that health authority orders may not conflict with executive orders of the governor and must apply control measures required by statute. So there are a lot of hands involved, and I think that's my main point from this. On the next slide, I just transitioned to on-campus learning, and this is just where we've been and where we are now. So basically, we delayed the start of school by 1 week to August the 31st, 2020. That was the first instructional day of school. 100% remote. It was allowed by TEA for 4 weeks, the Texas Education Agency. On September 24th, 2020, the school board approved a second 4-week transition window. And here's TEA's authority. They stripped administration or the board from delegating that decision to the superintendent and administration. It had to be a board decision. So that was September 24th. We had to allow students who were still having connectivity issues.
Dr. Canales, I'm sorry to bother you, but on the chat online, they're saying that there's no audio. They can't hear online.
Oh, no.
Everyone's saying that they can't hear anything.
Mr. Martinez? We'll wait a little bit. Thank you, Ms.
I'm sorry.
Sensada. Thank you so
They're
much.
not listening.
We do hear audio on YouTube right now.
Okay, there's people here on the chat. If you go through to the chat, they're saying that they can't hear anything. Carolina Lopez, Maria Moreno, Raul Cantu, no audio. I guess if you keep talking.
You want me to keep talking? President Guerra? Do you want me to wait? We can wait a little bit. Can you hear it?
They're asking if there's slides being presented, but there are no slides being presented, correct?
There should be slides online that they can see.
Carlos is checking them.
Okay, I think they're using a different link because some people are saying they can and some people are saying they can't. There's a different YouTube link.
There we go. Probably.
They must be using the YouTube link on the board agenda.
Carlos, should they be using the WWISD US Superintendent, that one, that link?
The link on the board agenda?
Yes, is that the one they should be using?
Yes.
Okay,
Carlos, can you put it in the chat so those that are having problems can
right.
see the website?
Down. Okay. So did we put the link in the chat? I think we've just about done that. Sorry.
So it's the Google Meet link that's not working, but YouTube is working. That's
Okay.
what's happening.
Okay.
The Google, whatever Google Meet link they're on is not working, but the YouTube link is working. So I guess those of you who are on the Google Meet, if you can
Select-
just log in through YouTube, you'll be able to hear it.
Correct.
Okay.
And then
Where are your slides, Dr. Canales? I can't see your slides either.
Okay. We'll have to fix that
Well-
to the radio.
In the
It's in the invite.
interest of saving time, you know, and all of you being present here, and I do appreciate your presence. The primary reason for being here is to address the transparency of how we're dealing with the COVID-19 issues. We understand what is in place. The question is, and I get these concerns addressed to me, is that at individual campuses, when someone is sent home, or if somebody tests positive, we understand the HIPAA law and that names can't be revealed, but a lot of the personnel see that certain people go home who they were in contact with, and nobody's telling them anything. So their concern is, why are we being left out of this equation? If so-and-so was sent home because of safety measures, then why was I not sent home? And I think we can start with that. You know, we want to be very transparent of how we do things, and I've had multiple calls of people with those concerns, and in their eyes, they see that, or they think that things are being covered up and being kept hush-hush because we don't want to create a panic. So my question is, how can we resolve this transparency issue and be more clear about how we let people know what's going on?
Okay. Those are good questions, President Glad. And we do have, and I would love to get you all the slides. So, Mr. Martinez, if we can make sure that the Board of Trustees can see the slides. I think he's working on something else right now. And answer that question, because we do have our protocols for that. And Mr. De La Rosa and Ms. Kaufman, who are right there, Mr. De La Rosa, they work together. Ms. Kaufman takes the leads for students, and Mr. De La Rosa and his staff take the lead for staff. But the two departments work together for that. So I'd like to pull up the slides on that, and Mr. De La Rosa, I think if you could go first and explain that part so that we are clear about the steps that we take at the district and the campus levels when we hear of a COVID-19 positive case. That's what you're,
Yeah.
is it okay? Okay.
So, Mr. Martinez, and first of all, good evening, Mr. President, Dr. Canales, members of the board. So I'll go ahead and jump right to the slide. Carlos, if you can bring up slide 77, we can go ahead and start there. And I think it'd probably be key for people to follow along remotely and kind of see what everybody else is seeing. So I'll wait till it gets projected up on the screen, if that's okay, Coach Cuellar. Or I want to make sure at least you all are seeing it.
Probably if you share it from your, you don't have the slides on your screen, so you can share it?
I do. Let me see. But if I share it, Carlos, if I present, will it come up there?
Yours doesn't show, right?
No,
It's not.
we
It's
have
not
to
on the
be in
screen.
presentation mode.
Okay. Because if they share the slides, then we'll be able to see it.
We can see it from, I mean, I know I can see it from here,
Oh, okay.
if they just want to pull it up.
Yeah.
Yeah, whatever.
So just tell them we're gonna go on break for 5-minute break.
Okay, we're going to take a 5-minute break to address the slide issue so we can see what's being presented. So we'll resume this workshop in 5 minutes.
Those of you who are on Google Meet, Mr. Elias Trevino posted the YouTube link. That way you can hear. If you are not able to hear on Google, you can follow the YouTube link that Mr. Elias Trevino posted. Thank you.
I think that if he can't figure it out,
Okay, just want to make sure that everybody can see the slides. Feedback.
Well, they were on. There you go. Okay, Carlos, we can see. Oh, went back. There you go. Got it.
Ready, Coach?
We're good?
Mr. De La Rosa, continue.
Okay. So the first couple of pages of my part in the presentation dealt with isolation of communication protocols would be part one, mitigation. I'll go through that very, very quickly, and we'll get into the meat of it. Basically, that all students, parents of all students are encouraged to keep their children at home when they're feeling any of the COVID-19 symptoms, as well as we direct all staff to stay home if they're feeling symptomatic. Next page went into face covering protocols, campus visits protocols. Of course, you all know we're a lot more restrictive on what we can do on campus. Unfortunately, at this point in time, gone are the days of parents bringing lunch to their kids, having lunch with their children. It's unfortunate, but those are the times that they're dealing with. So to stress more on what Coach Goya's concern was, the slide 77, which is, Carlos, if you go one back. So that's going to be the isolation protocols. And when it comes up, one more back, Carlos. So what I want to stress to the board and to the public is that we do have isolation protocols in place when a student is being symptomatic. They are sent to the isolation area where the nurse evaluates those students and contacts the parents and has them come pick up their child. So if there is in fact a positive case of COVID-19, whether it's a student or a staff member, we do initiate this protocol, and basically the way we have it stated in our back to school action plan is the highlighted area. So upon notification of a lab confirmed COVID-19 case on the campus, the district will communicate with teachers, staff, and families of students who were potentially exposed. Those individuals would be advised to self-isolate until cleared by the designated campus health coordinator, which would be the nurse and/or the principal. So going back to that, who gets selected and who is identified, the next slide is going to be, I'll just go through this real quickly, individuals confirmed.
Can we go ahead? I know we got a lot of information to cover. We can go back to that slide. Sort of comment on some of these slides, because there's, you brought up a good point. If a student is symptomatic, they're showing signs of COVID, now we're going to sit here and we're going to move the student from one area to another while they're possibly infected. So now not only do we have that section, or where we have them sectioned off, now we're going to transport them or whatever through the hallways there. And now, if he's touching or something, or whatever he may come in contact with, he's actually, now we're infecting that whole area. So I don't know if there's a better protocol there that we can do when and if something like that does happen. I know we're gonna, who's the first person that we alert? And the reason why we called this meeting is so that we can all be on the same page. So who is the first person that needs to be notified?
Well, to answer your question, Coach, the protocols that we have listed in this back-to-school action plan, basically we're taken from TEA public health guidance. So that is, I did provide the board members with a copy of that guidance. So what we're doing here as far as the isolation centers or the isolation rooms, transporting or moving that student into that area, that's of course separate. In a lot of cases, we do have a separate ventilation system where we shut down the air and then bring in an outer air filtration or HEPA filter system in that isolation room. So there's no really easy answer to that, Coach. We're following TA guidelines.
And that's part of the problem. I know TEA is just setting a recommendation. They're making a recommendation. This is what we recommend you guys do. But there's other measures that we can take to better protect our teachers and everybody on that campus. Because this thing is really getting out of hand right now. And that's what we need to really try to address. I know there are TA recommendations, but why move a student that is tested positive? There's got to be another way of getting him out of that area, because all we're doing is moving him from one area to another, and now we've infected that whole hallway, whatever it may be. I don't know, I'm sure every campus has their own isolation areas, designated areas, but, you know, and there's gaps, or there's falls in everything that we're doing, flaws in everything that we're doing. I know there's been comments where there's a kid that's been taken out of the classroom because he had symptoms. Then a teacher goes back into that classroom, whatever, nobody, or another teacher is not informed, she goes into that, or that person goes into that classroom, and that classroom hasn't been disinfected yet. So at what point does somebody else step in, close off that room, close off that hallway, maybe find the quickest way, almost like the emergency exit, when a student is infected, take them out through the quickest exit, just like you do on a fire drill, you know, because if he truly is infected, all we're doing is walking him through the hallways. You know what I'm saying? I mean, I hope I make myself, you know, you understand what I'm trying to say.
Sure, and I believe that's one of the reasons that we're here, you know, on this workshop, to try to, you know, explore these different options. And what it is, it's recommendations and, you know, guidance from TA and in some instances directives from TA. So when a child has symptoms, they are moved to that area. They are wearing their mask. They are continuing to be social distanced from other children. So in that case, the mitigation or the prevention of the spread is there with the masks, you know, and that is why they're sent to that isolation room, so they're not potentially, you know, I don't like to use the word contaminate, but potentially, you know, contaminating the area where they were, so that way that area is sealed off from the rest of the children. And then once that child leaves, then the team immediately goes in, and there will be another part of this that Coach Riojas will go into. There's a team that immediately goes in and disinfects that isolation area, isolation room. Now, as far as the classroom itself, when we are advised that in fact that this child did test positive, then there is a protocol to go in and disinfect the entire classroom. But then, you know, that's another part of this presentation. But I do have a scenario, Coach, if it would help everybody understand, it would be on the next slide, kind of more of like a real life scenario of what actually goes on and some of the promises or some of the problems that we have. I'd like to use little Johnny from the Johnny Day. So this has kind of been a combination of events that have happened over, say, 3 campuses over the last 2 weeks. So we have a student, in this case, little Johnny, comes to school and is exhibiting COVID-19 symptoms. So he's sent to the nurse isolation area where he's evaluated by the school nurse, okay? So the parents are immediately contacted to come pick up Johnny, and the nurse speaks with the parents and advises on the return to school protocols, which was on the previous slide that we skipped over very quick. And the school also advises the district health coordinator, which is the head nurses, who is Ms. Kaufman, who is here today if she has any questions. And then the case management protocol begins. So this is kind of where we're going. So next slide. 2 days later, mom calls the nurse and advises that Johnny has tested positive for COVID-19. So at that point, the school nurse, the head nurse, and risk management, we meet to conduct contact tracing to determine who in fact was in close contact with this individual. And there's a quick little blurb on what that is as defined by the CDC. But this is a very, very, you know, tenuous process, because we don't want to leave anybody out. We want to make sure that everybody, you know, who is identified is evaluated, is contacted promptly. So Carlos, can you go to the next slide, please? So when we talk about close contact, and this is verbatim from TEA health protocols. The definition of close contact is evolving. TEA understands that, CDC understands that, so the situation is very, very fluid. So basically anyone in general, close contact is defined as A, being directly exposed to infectious secretions, being coughed on directly or sneezed on directly, okay? Or B, being within 6 feet for a total of approximately 15 minutes throughout the day, okay? And there's a lot of verbiage there that, it indicates, factors like case contact or masking. So what this paragraph means basically in layman's terms is within 6 feet for more than 15 minutes, a cumulative 15 minutes throughout the day without any facial protection or masks. Now, we do consult with the appropriate public health agency in the case where there's multiple students involved, because say there was 8 students in the classroom, they're all social distanced, they're all wearing their masks. So if the protective measures that we have, if these things, work, then realistically, well, then no one would be in close contact. But we defer to the county health department. And then in the case that we're talking about, this real life scenario, the next student, the county health department said no, all the students, since they were together in the classroom for more than 45 minutes, all the students were potentially exposed, okay? So in this scenario, we have 8 students. Next slide, please, Carlos. In this scenario, we had 8 students who were in Johnny's class, okay, 48 hours before symptom onset. All the students and teachers were wearing masks and were properly social distanced. So again, in this case, we did consult with the Hidalgo County Health Department, and we consult with the health department on the majority of cases that involve multiple students, okay? Ms. Kaufman is here. She can speak to that additionally, more if you have any questions. So again, in this situation, the county advised that since students and teachers were in the classroom for more than 45 minutes, everyone was determined to be a known close contact, the teachers in that classroom and the 8 students. So this particular case, there were 8 students in the classroom and 4 staff members who were sent home to quarantine. So when this happens, every single parent of a child who is potentially exposed gets a phone call from either the campus nurse or the school principal advising that their child may have been in close contact with a known positive case of COVID-19. So next slide, please, Carlos.
Now, at that point right there, we're informed, what about the classes around there or anybody that was with that teacher or anybody? This is where we put ourselves in a tough position. What about, the kids are sitting there in that classroom, but before the day started or what have you, they were with some other students, socializing, whatever, with some other students. This is where we lose track of those kids. And, I don't know all and that's why we're here, to see what exactly, do the kids get to the school and they directly go straight to their classrooms? There's no hanging out, I'm assuming, and everybody's we're trying to keep them 6 feet apart as much as possible.
Yes.
But at some point or another, regardless from the point when they're getting off their cars, from their parents dropping them off, or the buses or whatever, this is where we need to make sure we keep them all apart. But, out of those 8 kids that are all infected, obviously that's almost a school shutdown. You got to shut that school down because that's how this thing is spreading the way it is. This
Sure.
COVID is spreading.
Right,
It's not just a confined 8 and that's it. Let's quarantine the 8 now. Well, now we need to backtrack possibly from the start of the day and how many other people did they come in contact with?
Yeah. And that's the tricky part, Coach. I'm sorry,
Yes.
Dr. Canales, I didn't mean to.
well, go ahead and finish the round.
So going back to that, and I'm going to get into the intricacies of the contact tracing, Coach, and you're correct, it's very, very difficult. But going back to this, each parent gets this letter with the direction to quarantine to 14 days. Again, any staff member, in this case, the staff members that were in close contact with this student, they received a similar letter from the Risk Management Department advising that they needed to quarantine for 14 days.
But you're doing this, Mr. De La Rosa, 2 days after? Because for me, I would want to know, of course, right away, the rapid test done 15 minutes. You said in the previous slide, 2 days after exposure is when we're notifying people. I think that's too long, 2 days, to wait after a child has already been exposed at school, and then 2 days later. That's what I saw on the previous slide.
I believe
think
that that's being confused with when we identify, if a student is symptomatic and we get that, we have to go back 48 hours prior.
Okay.
So if we get notice that a student was, let's say today was Wednesday, if we get notice that on a Wednesday that we get a positive notice, so we have to go back 48 hours from that date to identify those individuals who may have been in close contact.
But you are notifying on Wednesday, as soon as you find out, everybody's notified?
As soon as we find out and as soon as
Okay.
we identify these individuals, then they are notified that day or as soon as possible. The principal and the nurse make the contact with the parents of the child. And then, of course, the risk management department contacts the employees. So it is a team effort. It's not just risk management, it's not just the nursing, but the campus administration is involved, obviously. So when we identify those staff members, they're immediately, tapped on the shoulder and said, hey, you guys need to go home, wait for a call from risk management, and then they get sent home immediately. And then we follow up with a telephone call and a letter directing them to quarantine for 14 days.
Adding to what he was saying about the isolation rooms, this was a concern that was given to me. Does every school have an isolation room, not where there's high traffic area? For example, a nurse's office is an isolation room. Does every school have an isolation room that has its own air filtration system or away from a high traffic area? Or is it everybody picks their own room? How does that work for every school?
Before we had the in-person instruction start, each campus walked with the maintenance department and the HVAC department and identified a room that's away from high traffic areas. And a lot of our campuses, in fact, the majority of our campuses do not have separate air conditioning systems. So it's all one big chiller system or, one big unit for the whole campus. So in situations like this, and Mr. Garza can come in and interject, if in situations like this, they are actually shutting down the ventilation system to that room and installing a HEPA filter and a separate air cooling system in these classrooms. I don't know which specific individual campuses are doing that, but I do know that we do have those. In fact, we can get you a list of which those campuses indeed have those, either a separate filtration system, a HEPA filter system, and even the separate air conditioning unit.
Mr. Nieto.
So it wasn't at random.
I had a question in regards to the contract, the contact tracing. Do you also look at the mode of transportation? Like if the student rides a bus, do you also follow it all the way to the bus number, identify the bus driver, the students that are riding in the bus as well, that might not be in that class?
Yes, we do look at we go back and we see, and this is done, like I said, with the nurse and the parents. So, but you have to remember that just because somebody was on the bus doesn't mean that they're identified as a known close contact, because you have to have that within 6 feet for more than 15 minutes without a mask. So with the transportation department, all students are required to wear a mask during transport. We don't have a lot of students on the bus, so the bus driver makes sure that they're adequately social distanced, so you don't have 2 kids and one in every row. They're spread out pretty far. So in a case for a bus driver, that individual would not be identified as known close contact because he did not meet that threshold, or he or she did not meet that threshold.
So the threshold that we use is from the CDC, correct?
That's correct.
It's 15 minutes. It was at one point consecutive minutes. It's now cumulative. Anytime, you can be 5 minutes with somebody who's positive in the morning, 5 minutes at lunch, 5 minutes in the afternoon. That would be defined as close contact. As before, it had to be 15 solid minutes within 6 feet. That's the new?
Yes, when we identify, we use those parameters and identify the individuals who were in known close contact. So,
And then, Mr. Nomaz, and then to the other point about the entries and exits, each campus principal does have an entry and an exit plan, and those are good points. Are we keeping children separated, and do they go straight to the classroom, where they're going to be in, and how do we manage that at the end? Right now, we look at our student numbers every single day. We send a message out to our parents, letting our parents and everybody know that on-campus instruction is a parent choice, and the commissioner has said that it will likely be a parent choice all year long. It's a parent choice. Friday, before we left for the Thanksgiving holiday, we had about 1,403 students in attendance. Today, we had 1,299, I think. So about 100 less in attendance. So, we take a look at the data. The numbers, we have more children attending the elementaries than the middle schools, and we have very few at the high schools, even though we have a hybrid schedule that we're allowed by Texas Education Agency for high schools. So as part of that, when we began the school year and as we moved to where our transition period was over and TA said, okay, Weslaco ISD, this is it, on-campus instruction, we had a campus checklist that we developed to go look for different things. Is there an entry and exit plans? Now, we count on our principals who are there every single day working with their staff and teachers to make the modifications needed to do what you said, to make sure that we keep kids separated 6 feet, apart to the best of our ability, not only when they enter, but when they're transitioning, if they do have to transition to different places, and then when they exit. So, we can continue looking at how can we refine that. Now that we've been on campus instruction for several weeks now, a few weeks now, it's always good for all of us to look at what's working, what's not working, how do we tighten it up? Because, I had a conversation with President Guerra even today, and, our conversation was it's hard to create a win-win. The win-win's going to be that vaccine. But when will that vaccine come? And will people want to take the vaccine? And how effective will it really be? Right now, that seems to be the only, clear solution to giving us some type of normalcy. But until then, we're open to continuously refining. We're in the business of teaching and learning. Every single day there's a lesson, and we should get better every single day. And
Yes.
I know our principals,
Yeah.
with their teachers and their staff, with the team, with the Board of Trustees, that's what we strive to do. So
Yeah.
if we need to look at, and debrief, we'll debrief and look at things based upon lessons that have been learned. How do we tighten this up?
Going back to what I started with about transparency, in very simple English, that everybody can understand, how are we going to make our staff and parents of our children feel comfortable about being in an environment where the COVID-19 does exist, where people have been sent home, test positive, and I understand the protocol, and I'm gonna share with you what I went through in my own household. My son came and told me that he had been in a large building area with 2 other employees that weren't feeling well, went home, tested, nothing, came back, weren't feeling well, tested again, tested positive. And my son Mark says, Dad, I got to tell you something. I was in a room where a couple of the guys that I worked with were tested positive. And they know about it, and whatever this tracking protocol was used, left him out. So just by telling me that, I said, well, let's see what happens. So I called Dr. Canales. I talked to Mr. De La Rosa, and he goes and gets tested, and he tests positive. How many days was he positive in a household where my wife and I are both diabetic, we have other health issues, and the risk of getting sick with this thing was a reality? So again, my question is, what are we going to do to ensure that our staff and students are going to be in an environment where they feel safe and trust the system? Because we really haven't cleared the transparency issue. We're talking about a lot of things, but we're not really addressing the issue here. We're in this room, for example, and somebody comes in and talks to Mrs. Sustaita and Mr. Nieto and Costa Trevino. They leave. Everybody else here was 6 feet apart.
Sorry.
They weren't in contact for whatever, and nobody tells them anything. So they're left to use their own imagination as to what's going on. Why aren't we being told what's going on? What's the answer to that?
Well, Coach, I can tell you that we're being as transparent as possible. We're being 100% transparent with the information that we have. Sometimes it just takes a little bit of time, and I do believe that we spoke about this. So, Carlos, can you go to the next slide?
No, well,
So, next
on
one, Carlos.
what Dr. Canales said and what Coach said, I know the transparency issue, and Carlos, I know you, or Michael, I know you say we are transparent and so forth, but the information is taking too long. We don't have, by the time we get the information, we're getting the information before the public gets it. And we're obviously getting it from within, the system from within, but that should not be happening. As soon as somebody is positive or whatever it may be, we need to be more diligent about posting the information. There's no way I don't understand how the whole day can go through and we hear it in the evening, hey, so-and-so is, and it hasn't been posted on the dashboard, nothing's been updated. That's part of the transparency. I think if we were more transparent as a district, we wouldn't be sitting here right now.
So Mr. Trevino.
Excuse me real quick.
Yes.
First and foremost, for all of those that are here in attendance, thank you for being here and taking time away from your family. Number two, thank you for what you do on your campuses, because mine have been back on campuses September the 30th. And y'all run a tight ship. I know as a parent that I am risking my sons to be on campus. I know that as a parent. And that's what the state has said. It is a parent's choice. The transparency, I don't know where y'all get that they're not transparent. Now, we may get issues at the end of the day or an update at the end of the day, but they have to work all day to run the district by the time we get it at 5:30, 6 o'clock. So, Mike, Oscar, the rest of you here, I appreciate everything that y'all are doing. Transparency, I don't know what else y'all need.
I think by transparency, he just means, are they left to assume? Like, for example, this is a question. Maybe the principal, they know the entry and the exit point at the school when somebody has been exposed, but do all the teachers know the entry and exit point? If we go to every school and we ask the teacher, hey, what's your entry and exit point when you've been exposed? Are they all going to know what door that is, or are they left to assume?
Carlos, can I have the next slide, please? And I'll address that real quick.
That's what I mean about transparency. Do they know the protocol?
Okay, so.
What I knew before our students were allowed back on campus, the 30th, that week that the staff came back twice, and then the other half twice, that's what they went over. As far as principals delegating to their staff, these are our procedures. Again,
So-
I know Mr. De La Rosa is trying to get on to
Mr.
the next slide,
Gonzalez,
but
Andrew, that's a good point, because I know the principals cover all those protocols with their staff. And then when students came in, I'm assuming, but I know all the principals, that they also met with their staff or the teachers and the students to make sure they follow all protocols, because that's what Dr. Canales directed them. And principals, you're here, before you even started, you make sure that all your staff follow all the protocols, whether it was social distancing, wearing a mask, whatever it was, sanitizing. Those are things that are covered by the principals with the students and with the staff. Now, Mr. Trevino, good point there on the isolation room. Every school with the principal decides on where the isolation room should be, because again, I think Mr. La Rosa mentioned that they select a room that's away from the majority of where the students are going, right? Correct?
Correct.
And so the principals did that too. It's difficult to say you're going to keep students social distance 6 feet apart, especially at the high school. It's difficult. But they also spoke to the security guards, whoever's in charge of the security guards, to make sure that they let the students know when they're arriving to make sure they keep the social distancing. It's an integral part. The principals, security personnel, staff, teachers, all those things, and of course the guidelines that the state recommends too. We follow those. So, again, so continue, Mike.
So Coach Savino, just to address the question that you had, so it does take time. It does take time when we're made aware of a positive case. It takes time to conduct the contact tracing, not only for the employee side but the student side as well. So, and when we do these things, we have to be very cognizant of an individual's right to privacy. We have to be very cognizant of FERPA when it comes to student educational records. Students' medical records are considered a part of their educational records, so we have to be very, very careful not to identify anybody by name. We have to be very, very cognizant of HIPAA as it pertains to an individual's personal health information. So we have to work in a way where this individual is not easily identified. In other words, you have to be very, very general. And then when we do conduct contact tracing, and I know I discussed this with Coach, back a couple months ago when the instance came up with his son. And I'm going to use a term that used to be in the early computer programming days on the computer, but I'm going to use a term called garbage in and garbage out. So the information that we have is only as good as the information that we receive. For example, when we conduct contact tracing, when we interview an employee, and we ask them, okay, let's go back 48 hours. Who were you in close contact with? Within 6 feet, for more than 15 minutes, without a mask? Were you coughed on? Were you sneezed on? Or did you cough on anybody? We have to go back 48 hours. So there may be a case where they don't tell us. We don't get the information. Oh, I had lunch with my best friend. Oh, we didn't get that information. Okay. So we're not going to be able to identify everybody because the information that we have that we identify is only as good as what we get. So, I'm not saying anybody's lying. I'm not saying anything like that there's any type of malfeasance, that's trying to be, impacted on us. People forget. People, that's right, I had lunch with Mr. Perez the other day, and I didn't mention that. So I'm just using that as an example. So, we have to do our due diligence to maintain employees and students' right to privacy with the balancing of, advising them and identifying the individuals that we're in close contact with so they can go home and isolate. So we try and contain the spread as best we can. So, it's not a matter we're trying to hide anything, we're just not being transparent, is that there's certain procedures and steps we have to take to make sure that we're covered on both sides. It's a very tedious process, it's time consuming, it's very, very delicate and sensitive, obviously. So we do have to do our due diligence. So that's why if we get a positive case, you're not notified right then and there. We have to go through the steps and the protocols, and then that's when you get that email at the end of the day or close to the end of the day, and then updating the website or the dashboard, if you will. We're working on doing that twice a week. We're with Carlos Martinez in the technology department, but we want to make sure that we're giving you accurate information and
Correct.
not false information. So
Now, with saying that, Mr. La Rosa, CDC updates their protocols and their guidelines. This virus is constantly evolving.
Mm-hmm.
And their guidelines, and I believe you were reading the more accurate, you were reading the most recent ones that are out right now. With a 5-minute, the 3
Cumulative.
5-minute interval, that's the most recent one.
Right.
So we need to make sure we stay on that CDC or we continue to update those guidelines because, again, this virus is evolving as we speak. And I know Mr. Nieto brought up, I know the protocols, principals went back to campuses, and one of the reasons we asked you to be here today is so that we are all on the same page. I know there's assistant principals that are not aware of step 1, step 2, or step 5, whatever it may be. It's just an example. But I know for a fact that we're not on the same page. I don't care how we could have done all these trainings and so forth, and
So, yeah.
we're not on the same page.
Mr. Trevino, and you're bringing a good point up. When the accountability system changed, I know I'm going to academics, we made sure that everybody was on the same page and know the basics, 1, 2, 3. What are the domains, 1, 2, 3. So what you're suggesting is that we probably need to do the same thing because the district and campus leadership not all of us can do the 1, 2, 3 for COVID-19.
Yes,
And what you're
yes.
saying is if we did that simple thing,
Yes.
that would help alleviate some of the fears and concerns at campuses, from what you all are hearing.
And it would bring some ease to the parents as well. I think the parents we would all be pushing out the same information, and now we wouldn't have the 100 questions from the parent, hey, well,
So-
what should we do next, and so forth.
Yeah, so while we've done trainings, because we have done trainings, it's about being purposeful redundancy because it's something new in terms of bringing it up, and we know the rules, like we know the accountability system, domain 1, domain 2, domain 3,
Yes,
that would help.
yes.
I wanted to go back because I have principals here in the auditorium, and I wanted to ask back to the whole, if you've been exposed, everybody knows where to enter and to exit through the same door. Does every school have that, where this is the door where you're going to exit or you're going to enter after being exposed? Or is it just kind of up in the air, like, well, we'll see where you go out through?
I'm going to defer to a head nurse on this one.
Hello, good evening. Basically, on the schools that have a door across from the nurse's office, Northbridge, Memorial, if we have a child that's been exposed or a child who's ill, the parent will come around there and they'll go out that door.
What about staff? Do the teachers know, you know what, there's a kid in my class who's been exposed. I mean, I've been exposed to a student in my classroom. This is where we're going to exit the school. Is that clear to the staff? Because those little things give peace of mind, just so that they know. Does every school have that, or is it kind of, I'm assuming I just leave?
The nurses handle the kids, the principals usually handle the staff. I think what the biggest breakdown is, there's two things that were going on here. There's people who are exposed and there's people who are symptomatic. And we have a lot of staff that are coming to school ill and then deciding to leave and get tested that day. So we need to get we need to make sure that the staff understand that their health affects everyone also. So we need to, if you're not feeling well, you need to stay home. And then, we can go with the exit and the entrance.
I think that would be a good idea for all teachers to know. If every principal here says to their staff, this is where we're entering, exiting, you've been exposed, this is your area, that just lets teachers know, okay, at least I know that. So if every campus could have that, that'd be a great idea to have for each campus, so that their teachers know exactly what to do after they've been exposed.
I think the concern or the question is, exposure. We don't find out if somebody's positive when they're exposed. And so, I know going back to the timeline and the notification, a lot of times I've gotten calls and staff, they find out, they start talking first, that's how those rumors start, and we don't even know if it's a positive yet. That's just, we're saying, maybe that person told somebody, and, then they themselves can say the name, because they don't have to worry about HIPAA. Being in the medical field, I know how important HIPAA is. So just because somebody was exposed 2 days ago, and they walked by a doorway, I don't think myself, I wouldn't be afraid of walking through that doorway 2 days later. So I think we're also talking a lot about, the students and what do we do with the students. I think one of the biggest concerns looking at the numbers is what our staff is doing. So I think there's been more positive staff members than students. And so somewhere along the line, staff members are breaking protocol and end up testing positive. When I'm in an exam room, in a 10 by 10 room, and I see about 20 different patients a day just wearing a mask, I really, with the little ones, I'm not really even too concerned about them. It's the adults that are socializing and maybe going out to dinner without a mask with somebody that's not within their circle there. So, in the situation where the timeline and am I being notified right away, rumors start right away. Right away somebody can start a rumor. But as a district, I can understand why it takes time to find out if this person was positive. And once we get that positive result, then that's when all the events start, where we start the contact tracing. Now, I know in some instances, staff is saying, well, I didn't get notified. Well, contact tracing, correct me if I'm wrong, Mike, it's how far do we go? Secondary contact, tertiary contact, we can't be going on and on and on. At some point, it has to stop, and not everybody's going to be exposed just because we had a positive case in the building. So I guess that's where we need to kind of maybe, say if you want to talk about transparency is who are we considering, is exposed, and at what point does it stop? Secondary, tertiary, at what point does it stop?
And I
That's a good
agree with you, Doctor, but see, we're talking about what we're gonna do, and that's where the consistency of how we've been presenting stuff is gonna be important. Because once and it doesn't hurt to say, you know what, you don't have anything to really worry about, a little extra something to reassure our staff that we're not trying to cover anything up,
Correct.
We've addressed what we need to address, and you're gonna be okay. But if you have an issue, or if you have a problem, you can get tested and, clear the air. Don't tell them, vete, don't worry, or don't say anything.
Right, so,
That's what starts, so these rumors can spread like a wildfire. So the best way to stop that is to address the thing. If someone has a concern, deal with it, do a little diligence and clear the air.
Correct me if, I don't know if I'm right or wrong. I obviously I've worked in the field with COVID. Somebody can test negative, 24 hours later, and then test positive 4 to 6 days later.
You're correct.
you're correct.
Yes. So this is why, this is why it's very urgent that we all get on the same page
Right.
and come up with the best plan possible, because whatever was in place for September may not be appropriate for right now in December. We need to look at our plan of action also as well, because of that. I know you brought that up, Coach, but just because somebody tests negative, 24 hours after being exposed or whatever, they can test positive 4 to 6 days later.
Right, and so there's a couple things, and I don't know, one of you said it, about the COVID-19 symptoms. We need every staff member and every student who has symptoms, and there can be a lot of things that you have that are symptomatic, allergies and a whole bunch of different things. But if you have the COVID-19 symptoms, staff, people with computers and access to computers, we have to fill in every single day that I don't have COVID-19 symptoms, nobody at my home has them, and I haven't been exposed to anybody, or in contact with anybody who has it. Every single day we do that before we time clock in. For staff members that we have who don't have computers, there's a different way to do it. It's on their time cards by day where they have to note it. So we need, our staff to understand, and also our parents to help us. We're going to get through this together. But if you have any symptoms, stay home. Don't go to school to be sent to an isolation room or to have your principal come say, you know what, you need to leave, you've been coughing, stay home. We can work out those things. We have right now 1,300 students who attended today. We're expecting more tomorrow. We can figure that out. So I think that's important. The other thing is to clearly define what exposure is versus COVID-19 positive. And you're right. I can test negative today, and I can test negative 3 days later. And then I think the average period of being symptomatic for it to show up on test is how many days? 5 days. 5 days. And so I've got to be really, really careful, really careful about that too. The contact tracing with the 48 hours, that's been pretty standard. That hasn't changed. Looking at Mr. De La Rosa and Ms. Kaufman, that hasn't changed. The 48 hours, You
No.
asked 48 hours.
That's been
Who
pretty
did you have
consistent.
contact with?
It's
I'm
been
sorry?
pretty consistent. The only thing that's changed is the duration. It used to be 15 minutes at a time. Now it's a cumulative throughout the day for 15 minutes. So, and just to go back on Coach Trevino's comment, so the example that I use in this PowerPoint were the 4 employees that were advised to isolate. So those 4 employees, they get a phone call, and I have one lady, she's fantastic, and, knock on wood, I hope she doesn't decide to run off on me. But if you're an employee and you get that news, you have questions and you have answers. So we do take the time to stay on the phone with them and answer every single question, because the first thing we get is, well, I may be exposed, I want to get tested right now. Well, no, it's not the best idea to get tested right now, because it takes anywhere from 5 to 7 days for there to be enough viral load in your system for you to show up on a test. So it would be really, I don't want to say a waste of time, but not fruitful to go and get a test that day and you're negative. You say, okay, well, I'm great, and then 5 days, 7 days later, there's enough viral load in your system to show a positive result. So it just takes a little time, and that's to make sure that we do our due diligence. So I just wanted to reiterate that.
Another recommendation, with that being said right there, Mr. La Rosa, what about coming up with some type of hotline? So parents aren't calling everyone and anyone, at every campus, giving them the direct answers with some type of guideline where we're all given, they're all being provided with the same answers across the board. I know we have,
The dashboard.
I'm going to say, I don't know, maybe a little bit of a less workload right now, that since we don't have all the, and I shouldn't say that because I know there's people that have more
Yeah.
workload. But I know there's got to be there's campuses, I know Horton, I think, is one, that they're not operating with kids. We have people that can't answer phone, set up some type of hotline where those calls go directly to them or something, and they can provide some of these answers.
Yeah, we can explore that. So you're talking to one place with a couple of people who are knowledgeable, have all the training, that can quickly answer parent questions.
Yes. That way they're
And/or
not
staff
calling his
questions.
office and their office and hold on and we'll wait till the next one. And that way, maybe we can put something together.
The back-to-school action plan states that the campus nurse is the primary contact for questions. So, and Ms. Kaufman's trained all the nurses, so they're fully aware. Parents' questions, that's who they call as the school nurse, their campus. Employees, they call risk management. But certainly, I'd love to explore that because we could use the help.
Yeah, like today, that's what Mr. Dorso was saying. We're bombarded with,
Yes,
phone calls. And we have 2 staff members out, so, if we do that, okay. So it's something that we'll look into.
And along those lines, we did talk sometime back at a board meeting about staff that have serious underlying conditions, being able to apply for a waiver where they can continue to work from home, given the circumstances. What criteria is being used, for whether or not they get this waiver? Because I understand that we have people that have cancer, serious diabetic conditions, hypertension, other conditions. So what criteria is used on what's going to be considered as a good reason or not good reason? Do they have doctors' letters that recommend that you consider their health as a reason to work from home? Anything?
So right now, Coach, the way it is right now with the transition plan that was approved by the board back in August, I believe, Mrs. Segura, was it? Late October, when the final transition plan was approved, that required that all staff members be required to be on campus physically. Now, as far as an ADA accommodation, we have had several individuals apply for an accommodation under the ADA for underlying health conditions, like you mentioned, individuals with cancer, diabetes, high blood pressure that are more susceptible to being exposed. So the working from home, per se, is not an accommodation under the Americans with Disabilities Act. You're essentially, in order for ADA accommodation, you have to perform your essential job duties. So part of being a teacher and instructor is you have to be able to provide that supervision to your students, to your class. So working from home, again, you're not performing your essential job duties or your essential job functions. So that in itself, for working from home, does not qualify under the Americans with Disabilities Act. What we do is we have met with these individual employees that have underlying health conditions, and we advise them that unfortunately, at this time, because of the waiver that was approved, working from home is not an option. However, what can we do to help you feel more safe, more comfortable, more secure in your classroom? And we can offer anything from, N95 masks to an air filtration system. There's been numerous things. Some teachers have requested, well, I want the same group of kids throughout the course of the day. So I believe we had 42 more or less requests for ADA accommodations. The vast majority of them have come back to work. There are a few of them. Very few, maybe one or two that have either, retired because they're eligible or not being able to come back. But I believe that's an item for discussion later, but we're following what the approved transition plan was.
Yeah. And along those lines, when they do ask for it, all this is explained to them, and they understand what they're applying for and why they may not get the waiver.
Yes, Coach. We call an interactive process where we schedule a meeting with the employee that's requesting the ADA accommodation with myself, Mrs. Segura, the HR director, and Mr. Neil Garza, who is actually the district ADA coordinator. So we meet with these individuals and we conduct an interactive process and explain why that you have to be physically present, that you have to be able to perform your essential job functions. Working from home, again, not an accommodation at this time under the ADA because you're not conducting your essential job functions. So we meet with them, we say, okay, so now that we know what these are the parameters are, what can we do to help you bridge that gap? It's very, very similar to an employee who's in a wheelchair and says, hey, I need to get into my building, but there's no wheelchair ramp. So what we do under the ADA is we construct that wheelchair ramp so the employee can get in and do their essential job functions. Same thing, at least to the best of our ability, we do is what can we do as a district to make these accommodations so you can do your essential job functions. And again, a lot of teachers ask for additional desk shields or customized desk shields. Again, the HEPA filters. And so I guess, again, the vast majority of those meetings were successful and came to fruition where we do have the employees back at work. And a lot of the teachers have maybe one or two students and some of them no students. But those are the accommodations that we can offer under the ADA. And we hope that our interactive process, we hope that it's very clear and decisive. I think they understand it. A lot of them don't agree with it, but we're dealing with the situation that we have.
I think, or I believe under the situation that we're in, that ADA, I could see it being applied to a regular setting, but this is not a regular setting. And I would rather have a teacher teach my kid from home, a qualified teacher, somebody that's certified, than having a paraprofessional teaching in a classroom, because they're going to get a better education. So I don't see the flip side of that. If we have a teacher at the school who runs a high risk and so forth, yet they're teaching kids that are at home. So it's a flip side there. But we need to look at, I know we've had 81, 90 teachers retire, and obviously they retired in September after the fact, and it was due to this. So why not pay close attention to that? And if we need to review those guidelines that were approved in October, then we need to review them and see if we can modify some of those. But to sit here and yes, the ADA, I understand all that, but we are under a completely different epidemic right now where we need to pay closer attention. And I would rather have a certified teacher they run high risk and everything, teaching from home, teaching my kid, than having a paraprofessional, because we're putting a paraprofessional in a tough position too. That's a whole nother issue. Should they be They're having to do lesson plans. They're having to do this. Now, as a school district, we have every obligation to let parents know that, hey, your kid is being taught by, your student, I shouldn't say kid, your student is being taught by a full-time paraprofessional. I would want to know that, and I know that information is not getting out as well, and that's part of the transparency issues that we were talking about earlier.
I can't speak to the curriculum side of it, Coach, but what I can say is that we are operating under the transition plan that was approved, and should the board wish to review that, that is certainly,
Yeah.
certainly something that's under your privy.
So,
And then-
well, I have a quick question. The transition plan you said that was submitted and approved, that's kind of that is what is restricting us from letting teachers teach from home and other options like that? Because I know that there's terminology here that says that the school system has the option to work with teachers, especially those that have, like I said, underlying conditions, to work from home. But it's not actually it's not the state recommendations, it's actually the approved plan that we submitted prior, that the board submitted prior?
And that was actually another portion of the presentation, and that
Okay.
I think that Mr. Arlada could speak to with greater efficiency than me.
Okay.
However, just for clarification, I do believe that we're outside of that transition. At this point, we're not being governed by a transition plan.
Okay.
It is full parent choice, to my understanding.
Yes, you are correct.
Yeah, because the November 5th update and documentation states that the school system has the directive of whether they want to work with teachers, especially those that have underlying at-risk conditions, to work from home.
Correct.
Just like some of their school districts currently right now are doing split schedules and have teachers
Right,
rotating.
correct.
Okay.
Yes. So, yes, so the third transition plan, we applied for 4 weeks to TA, because with the third transition plan, TA had to approve it first before you could bring it to the Board of Trustees to approve. We asked for 4 weeks, we requested 4 weeks, TA said you have 3. So we have completed the 3 weeks, I think right before the break. So we're
I
done
think
with the transition.
we're not
periods.
asking for any more extensions. What I've been reading, the TEA website, it says there's different options. There's a hybrid, there's the asynchronous versus synchronous. So in other words, why can't we're not asking for any more waivers, why can't we as a district
Yeah, split schedules.
come up with another option for teachers other than say, no, everyone has to go back, all staff? Why does all staff have to go back? Why can't we have those different options that TEA is suggesting on their website?
Yeah, and
Maybe
we
we can look
can
into
explore
that.
that. And before the holiday, we had a conversation, and I did speak to President Cuellar about maybe some options. Every option is going to have its pro and its cons, but we'd be willing to just say, hey, here's an option, here's a pros, and here's a cons for that. Like, just an example, even if we went split and we rotated different people coming in per week, right? Then it would have to be the understanding, okay, for our teachers who will be there, you're going to get some students who aren't in your classroom. And your numbers may increase. Right now, you may have 1 or 2 because all of us are back. You may only have, you may have 6 or 7 in your classroom for that week. Parents may say, may have to deal with that, what I want my regular teacher. That's important for me, at least for the core contents. But we'd explore all of it. The good things may be, it is shifts by weeks. So we know who was there on the weeks in case there was a positive case, right, anywhere. So there could be, but we could definitely, explore alternatives, if that's what the board would like us to do. And we spoke about it briefly on Friday and then said, let's wait for the workshop.
Right. And I believe I asked Mr. Aguilar when we met, did you survey teachers? Did you survey parents to see what do they think or what is their opinion? Because we want to know how they feel and what do you think? Ask them for with their thoughts also. So I don't know if Mr. Aguilar.
Yeah, and just before Mr. Aguilar speaks, Mr. Aguilar, if you can answer that. For clarity, you're asking us to consider alternatives for teachers. Is that what you're
Yes,
asking us?
yes,
Okay,
yes.
for teachers, okay,
What options are available, especially for those with underlying conditions?
okay.
And that's what I'm saying, this whole purpose of this meeting, like everyone said earlier, is clarification. The administration and everyone has been doing their job effectively and putting out information and working with their staff and creating, as safe of a learning environment as possible. But I think the more clarification we have in general for the community and the staff, the better. That's what the purpose of this meeting is. And also letting the campuses know that we have our ears open and we need to know exactly what they need as far as the campus administration and also their staff. So like Ms. Ustaita was saying, the more surveys that are done, the better. The more buy-in that the staff has into this initiative and getting through this year and moving through this crisis, the better. The more confident they're going to feel because they have ownership of kind of the plan that's in place, and also the gear and the equipment that they're ordering and whatnot. So I just wanted to put that out there and let that be known.
Back to TEA, what I was reading, I was reading earlier today on TEA that they're requiring on-campus instruction to whoever wants to. It doesn't mean everybody has to go, but we have
Exactly.
to have open campus. That doesn't mean every single campus has to be open. That doesn't mean every teacher has to be there. So those are just options to think about. I know this wouldn't happen, but if you want to have one school open for, depending on the numbers, and the kids go there, there's so many different options we can look at.
Right.
And it doesn't have to be every single person.
And part of the plan, and I'm going to touch on it because they mentioned it earlier, was the desk shields, for instance. That was brought up as far as that. That's been a big community concern and also a staff concern as well with those desk shields that were purchased. And not trying to identify the source or when the decision was made, but the process. Was that when those purchases are made and into the future, are we consulting with campus principals? When those are we asking them, what equipment do you need? Have you surveyed your staff? What equipment do they want? The more participation everybody has, the more confident that the staff's going to be when they're there and they're providing instruction. And I think, and that's why that was one of my questions with the desk shields. Were principals surveyed for that? Were they brought into the process and asked, these are prototypes of 3 or 4 different desk shields that we want to purchase? Are they appropriate by grade level, elementary, middle school, high school? Children have different sizes. Is this going to be something that's productive within the classroom? Is this going to make the job easier, the instructional method easier for the teacher when they have to deliver instruction, that they actually see the students, or does it matter that actually it's white or it's colored and they can't see through it, it's not transparent? So that was kind of one of my concerns as well too, and I know that Mr. Alonso brought up desk shields in his presentation, but that's one thing that I want to bring to light as well too, is to ensure that when equipment is being purchased, one, that it's something that's going to be productive and effective, and two, that we had campus input, and that the campus administrators have input as to what type of PPE gear is being purchased for their campuses, because everybody has individual needs, different staff needs, and also the ages. and the
Of what
grade
may
levels of
work, may not
students.
work for an elementary, that may work for middle school or high school.
And as we speak, we don't want to overlook every person that works for our school district, because it's safety for all staff, and we don't want anybody to think that any one position is less than another, because life is life, and we value that. So I'm very hopeful that we take all that into consideration every day, and that the personal protective equipment that we say we're going to provide is there, and that we fulfill that obligation to all our staff, because we're asking them to be there, and we're telling them that we're going to guarantee we're going to have certain things, and it's important to have it, because I've been told, I'm going to shoot straight with y'all. They tell me that they don't have stuff available. Now, after the fact, some things showed up, and we're there. So that's what creates this distrust and questions as to, are we really being transparent? That's what the transparency is. We say we're going to do something, and we don't. Now, that may not be true for every campus, but it has happened at some. And you're not gonna fool people that are there. So if we're gonna do it, let's do it, and that's all that we're gonna push for. Follow through with what we say we're gonna do. It's safe, then let's make sure it's safe. Anybody else?
Dr. Canales, correct me if I'm wrong, but when you all worked on this plan as to the transition plan, you did get feedback from principals, correct?
We did, yes, we did.
So a lot of the plan was formulated,
Yeah, and we
based
go-
on your feedback from
Yes.
principals
And through the district advisory committee team.
and district advisory.
And then with the shields, I know Mr. Rojas is here, and, he does things, to help out. And with the shields, the problems we were having at the time is it was hard to get shields. It was very, very hard to find them. It was going to take a long time to acquire them.
Are,
TA did not
are we
provide the
using
shields.
other vendors, ma'am, or did we get them all from one, try to get them all?
For the first order, for the students, we got them from the same one. And for the teachers, we wanted to make sure that we had the larger ones. We got it from the same vendor. We have ordered more because just as a safeguard, and our board, these went through approval through the process, right? We have ordered more. But to answer your question, when it came to the student desk shields, we thought, we have kids coming in, we need to get something that is actually going to be delivered on time. As a matter of fact, we were supposed to start September the 28th. The board approved a transition plan because the board of trustees at the time asked us, do you have desk shields? And we're like, they're in order, they're not in yet. So we didn't start school till September the 30th, which was a Wednesday. TA noticed that. TA said, hey, Weslaco ISD, week 5 began September 28th. You didn't start school for on-campus. You have no on-campus instruction. Why? And we said we wanted to make sure that all the teacher shields and the student desk shields of what was available at the time, because, computers, hotspots, a lot of other things became highly valuable items across the country. So we waited to the 30th to get them. Now, we know from feedback from our principals, and we saw it, hey, we need to cut some holes because we need some transparency, in what you were talking about, in the front of it. We also have ordered some more from a different vendor that already have the transparency built into them. So when possible, we involve, stakeholders, whether it's the principals, whether it's a district advisory committee, teachers of the year. Mr. Nieto and I have met with teachers of the year, on several occasions, asking, what's needed, how can it go? We invite, we have the site-based decision-making at the campuses too. We want input because together we are stronger, And so we want to continue, along that line. And so I just want to say that. But the question about the shields we got at the time, Mr. Los Santos, what we could get our hands on.
Right.
For the transition plan.
I have a question. When was all that taking place? What month was that, the purchase and the discussions and the meetings?
Coach Rios, do you know?
Gosh, I don't recall the exact date, Dr. Canales and Mr. De Los Santos, but it was...
Month is fine.
I would say, what was it? August, around August. Early August was when we were looking, and we definitely looked at different vendors and availability, different styles, and just, looking at the transition plan, and when we were expecting teachers and staff to come in, it was very important for us to have some form of desk shield for our students. And so those were the shields that were the most readily available. They were delivered to us within 7 or 8 working days. We dispersed them out to the schools as soon as we received them so that we could get them on our desks before the students arrived or started attending class. Here recently, just to answer some of your questions, sir, we run into issues with some of the shields. Also, some of our desks are pretty narrow. And even for the new order that we just placed that we're receiving here in a couple of days, or I think they're already here, Andres, we really looked at which would be the best one to sit appropriately on the desk so that our students are not fumbling around trying to keep the shield from falling over, because we have some desks that are pretty much in a lot of our schools that are only 17 inches wide. So it's a pretty narrow desk. And so we were really working with some of our principals. We actually went to go visit, measured, and we received probably 4 or 5 different samples on different sizes, and we came up where we agreed on the one that we thought was the most beneficial, more suitable, that would best meet the needs of our students for this new order that we just received.
I know I talked to you before about
Yes,
the
ma'am.
PPE and the clear tape holding them
Yes,
up. And so I got calls today from some schools that after the Thanksgiving break, they're coming apart. Their teachers got to school today and they're all over the table and the floor. If I want to send my kid back to high school or middle school, I have kids all over the place, I would not feel safe with the PPE on the floor. When can we see this PPE correctly built in the schools for the parents to say, you know what, send your kids back, the PPE is ready to go? When would that be?
You know, Mr. Saita, it's very unfortunate that that's happening, you know, and I say it with all sincerity because we really felt that we had purchased a really top quality product for our teachers. Those are our teacher desk shields. We went with a very, very qualified or well-known company called Indigo, okay? I mean, it is public and we need to know. That's who we purchased it from, and it's unfortunate that this is happening, continuing to happen. We have not released payment to them until they've fixed the problem. They have come in. I've worked with them throughout the past couple of weeks, even through Sunday, walking them to each individual campus, working with custodial and security to open, unlock, and address every single shield with some form of reinforcement that they're recommending. And unfortunately, that it's still not working, which is why we still are experiencing these problems. As far as we're concerned, I haven't discussed it at depth with Dr. Canales as far as, you know, what are I guess, legal ramifications for this problem. We do have a solution as far as a Weslaco ISD solution. It is going to be quite a bit costly in manpower, but we are prepared to do that. However, I just want some clarification, or I guess some direction from Dr. Canales to see if this is something that we want to do. Is it something that maybe we can hold cost and manpower for Weslaco ISD to fix these shields, and then deduct payment from the company as a means of, and maybe I'm out of line, Mr. Perez, but that's what I'm thinking. Because definitely, I agree, it's not what we paid for. And these shields were pricey, they were top of the line. We felt that they were, we wanted the big shield that was going to provide that safety for our teachers. And unfortunately, it's not where, they're not what we needed, what we expected.
Coach Oscar.
Yes, sir. Yes,
What
sir.
about, you know, just like what about having some of these companies send a sample?
We did,
As
sir.
much money as we're
We did.
paying, they did?
Yes, sir.
We did.
We actually had samples in the CNI room for a couple of weeks, different samples.
Before we made the purchase?
Yes, sir.
Who's looking at those samples, or who was the committees that were brought in? Was it everyone that you were saying?
No, we didn't have, we had different people go in and look at them.
Yes, sir.
But we didn't have, like, we didn't take the samples out to committee, take a look at all these samples for the teacher desk shields. For the student desk shields, we did rush those, like I was mentioning earlier, making sure that we could get them within 7-8 days at the end of the transition period. But for the teachers, it continues to be, it sounds a problem. I mean, if they're
Yes.
reaching out, and we've got to find out we got to fix a solution for that. And we have not issued payment to the company, and we will not issue, because it's, you know, staff has shared, it's a qualified company. We should not be having these problems with the amount of money that they're expecting us to pay.
And I
So,
did.
so they sent,
Yes, sir.
they sent samples
Yes,
to
sir.
you, you had them in display, you guys looked at them and so forth, and at the time they looked fitting, I'm assuming? and-
They look great, sir, at the time. Again, it's very similar to what you see here. Transparent, clear all the way around. They use some type of an adhesive, clear tape that I think our principals can attest, because they're, you know, they're right behind me, and I know that I've talked to a lot of them, that it's just not holding up. And so we went through and reinforced every single shield in the district. Lots of time, it doesn't matter. We were there, I was there, and we reinforced every single shield, front and back, and then also the corners. And, you know, it's still happening. So the reinforcement didn't work. And in some schools, it's a higher problem than others. But it is happening throughout. So we have not relinquished payment to the company. And I do have 3 different options where we can take care of the matter ourselves. It'll be a little bit time consuming and a little manpower and funding, of course, but we definitely can. We have some great guys in our maintenance department that are very skilled, and man, they've already come up with 3 solutions and cost as well.
Right now, there's not too many kids, obviously, on campus anyway. That, of course, I think if parents saw, though, me as a parent, if I saw, if my daughter's principal showed on the school website or something of, look,
Yes, ma'am.
this is the pictures of your class, your child's classroom. This is what the PPE looks like. That's going to get me to start thinking, okay, I feel safer that my child is going back. I want to see how it's going to look. So right now, we obviously, like I said, there's not as many kids, but once we do, hopefully soon,
Yes, ma'am.
get the PPE fixed, and the principals or the teachers take pictures, show the parents, show everybody, this is what it looks like, they'll start feeling safer. I think, I mean, I know as a parent, I would, and start sending the kids back, but we've got to show them this is what it's going to look like.
Yes, ma'am.
Yeah, and I was gonna, kind of hinting on that, I was gonna talk about something about that. You saw that other districts took pictures of their classrooms and sponsored those and marketed those out to the public. And they had their setup already in place. Like Ms. Usaita is saying, that's something that of course now we have to do. Because of, and I'm only saying because of the community concerns and the community outreach and the way that they're thinking. They want us to be proactive.
Okay.
We know COVID-19 and this pandemic is not going away anytime soon, even with a vaccine going into the following school year, going into 21, 22. So the community, the concerns that I've been hearing is they want us to be proactive and make the purchases. We're talking here about safety of all individuals that work within the school district, regardless of department or campus or what level they're at or what they do as a job title, but making sure that we have enough PPE gear for not only our staff that's equivalent to not just a gallon of alcohol, but baby wipes, their own disinfectant bottles and whatnot, some form of kit that they can have so that they don't have to wait on the janitorial services, which I know are disinfecting and are working around the clock
Yes,
doing
sir.
that. But so that the teachers have their own kit within the classroom. Let's make those expenditures by quality materials and be proactive because we're going to have to deal with this well through May, going into summer, and then going into the start of the 21 school year, possibly. Hopefully, it's just a precautionary measure into the next school year. But that's the concern that I've been hearing, is be proactive, and we need to start ordering and preparing faster, because like you said before, and I don't want to criticize, but August was when a lot of the community members are saying August is when we started ordering these, when these orders had already been done in late spring. We already knew that this was a pandemic, a global pandemic, well into April, and you know, and that's kind of what I needed to discuss and bring out to light, is that just we need to be proactive.
Okay.
And do whatever is necessary to make sure that we order the proper equipment, and the equipment necessary, and equipment that the staff feels comfortable
Now that he says proper, because I was an elementary teacher, and I remember our tables, and I have friends asking me, you know, do we have kidney tables? We have round tables
Yes,
in
ma'am.
the elementary. All the PPE is rectangular. Are they being custom to the teachers who sit there and do guided reading, or are they Are they like circular shield, or are they all rectangular?
All the
Are they
PPEs
customized?
for, you talking about the shields for the teachers, ma'am?
Yes.
Okay, yes,
The
ma'am. So
tables, the teacher tables.
the way they were designed was, and the main reason for that transparent tape is for that flexibility, that mobility, so that teachers can actually kind of arrange them the way they feel best on their desks. That was one of the reasons why we felt that, okay, these are going to be great, because teachers are going to be able to maneuver them around their desks.
Okay.
And I think that tape, again, is just not doing the trick. But to answer your question, ma'am, yes, they all come in that
Rectangle.
three-piece section, rectangular sections. And actually, when they are delivered, they're delivered flat, so that they don't break. And so then, before they are taken and delivered to the classroom, the company actually will tape it, so that it'll stand erected upon delivery to the desk. Because it is, even though it is a plexiglass, it is very fragile. If you drop it, of course, it'll break. If you nick it, it'll crack, and we can have other issues with maybe somebody getting cut, things like that. So when they're delivered flat. Yes, ma'am.
And I think of the kidney tables, you can only social distance one student per. That's why I think in a lot of classrooms, you have a minimum of 11 desks, depending
Yes,
on
sir.
the
11 to 15, depending on
meet
the
the social
size.
distancing too.
Mhm.
Yeah.
Yes, sir.
Breaking away from the classroom a little bit, I just wanted to bring this up and go back to transportation. I know we talked earlier about contact
Yes, sir.
tracing.
Yes, sir.
And I know that, there's opinions as far as how far it needs to go and whatnot, but our bus drivers are the first individuals that make contact with students when they pick them up at the beginning of the day, and also the last individuals that make contact with them when they're dropped off. If we could look at that again and just make sure that, I think that if I'm a driver, and I'm going to say this, and I find out that one of my students that I was transporting in the morning, I'm in a small closed environment, the circulation of air within that environment as well, and they're positive, and then nobody ever told me, that's a concern to me, and I think to people within the community, because that's also something that I've heard. And then also, are we also looking at any protective measures for bus drivers? I know in other states, they're already designing not complete plexiglass enclosures, but some type of protection for drivers that's DOT approved. Maybe that's something that we can look at as well. So that way we can, focus within the classroom and the people in the campus that have contact with students, but also anybody else, such as the transportation.
Yes, sir.
You can have that.
Any further discussion?
Oscar, there's,
Yes, sir.
there's an example, there's two scenarios I'm going to go over.
Yes, sir.
We were hired by a school district. They had a custodian test positive.
Yes, sir.
So because that custodian goes all around the campus, they had our team go in and disinfect the entire campus. I'm talking about, they shut down the school. They had us there by 5 o'clock, and we were there, all hours, ready to go for I don't know if they did open or not the next day, but you can go back in the next day with the chemical that we're using. Another scenario, they had a staff member, an administration area, so they sent me the diagram. These are the areas that we need disinfected immediately. So again, we went in at 5 o'clock and disinfected that area that was shaded in green or whatever. So those are two examples to what a district is going to, the extreme that they're going
Yes,
to.
sir.
I know we're not shutting down at all. I know we have cases, and we're not shutting down. You may be having people go in after the fact, but these campuses or this school district to me is taking, they're going above and beyond. So you may want to look at putting a team together, and I think that would bring a peace of mind to everyone, staff and the community. If somebody tested positive at one of our schools, boom, that 4 o'clock, shut it down, whatever, or shut it down. And if it's a student and sort of where they were at, or if you can't tell, or if that administrator cannot backtrack to see what restrooms or whatever, then just do the whole campus. You have enough people.
Yes, sir.
Or you can set up a team, and I've seen you guys in action go in there, but I don't think we're doing that right now. I may be wrong, but that's an example of a school district that's hired us in 4 different situations because they've had people test positive, and they right away, they're very quick to act on things like that. And I think if we're doing, hey, they're coming in there, something happened, and they're being proactive and they're taking care of it right away.
Yes, sir, if I may respond,
Yes.
Dr. Canales. Good point, Mr. Trevino, and that's very important. I always say that we're very fortunate to have great staff here at Weslaco ISD. And one of the things that we've done since the start of COVID was to provide the tools and to provide the training to our custodial staff. It's very important for us. And so what we've done is we've created that team. We've had that team. First of all, the team dates back to March, early on when we were just starting with this COVID and positives, and we were dealing with the shutdown, and we had maintenance and custodial still working on a daily basis, and so we were dealing with some of those issues. We go back to, you guys recall Coach Cuellar and yourself, Coach Jesse, and maybe even Mr. Nieto, when we had staff infections back then, back in athletics, where we had a team that would come in after hours or after practice and would just do a complete disinfecting of the facility, mainly for athletics. We took kind of the same idea and just, working together with a couple of our staff members that were trained on proper PPE, putting on the proper PPE, and how to remove it after you've disinfected or sanitized an area. Provided them with the supplies that we needed, and then of course went as far as purchasing electrostatic sprayers with a chemical that's electric static, a charged chemical that that doesn't just sit on the surface, but really actually
Wraps
engulfs the
around.
surface completely. So we started that early on in March, and we were attacking areas of departments mainly, some campuses. We didn't have any students at the time. As we've progressed up until we are now, sir, that team is still intact, but we've taken it a step further, and we've trained every single campus, head custodian and team, on the same methods of putting on your PPE, removal of PPE, areas to target in a classroom or in any area where we're told, hey, you know, we have a positive, he or she or student was in these areas. And so I have to say that our staff, you know, love them to death, but they were a little bit reluctant at first. Why me? Why do I have to go in there? You know, yeah, it's understandable. Everybody's afraid. And we did videos, we did trainings on how to properly do it. We did them live on how to properly, you know, disinfect the classroom. I learned a lot going to some of these trainings because, you know, things that you take for granted, you know, were really being addressed as far as disinfecting and sanitizing. I think you know exactly what I'm talking about, Coach. So we've done a lot of that throughout this time. And in the event that a positive has been detected at a campus, either I or Mr. La Rosa will probably get a call, or I'll probably be one of the last calls that they make, which is perfectly fine. But what we do is we send our team, our sanitizing team, into those areas that are identified to us as, okay, you know, these are the areas they may have been in contact with. And we take the exact same protocol and we follow it throughout, and we do it after hours. We try not to do it during the day because we don't want to alarm anybody. So if I get notified during the day, what I will tell the principal is just make sure that the room is locked, make sure there's no traffic through that area, and then we will be in there as soon as, you know, 4 o'clock, 3:45, as soon as the last person leaves, and we'll definitely attack that area immediately. And we use, again, the Lysol disinfectant. We use all the stuff that we use is EPA approved to kill, you know, obviously COVID-19 and many other infectious things that may be out there. And so we follow that process, sir, throughout. And again, you know, I'm very, very happy, very pleased with the work that our custodial department has done. I'm hoping that our principals behind me agree, but you know, we're doing everything that we can, sir, to take care of the matters in-house by providing them with the training, understanding that some of them are apprehensive, they are a little scared, you know, sometimes, but we've been able to take care of it in-house. Yes, sir.
A question that was brought up, and maybe you can clarify. Some teachers are mobile, they move around. For example, the like ELF, the Head Start, they go into different classrooms or different Head Starts. Can they carry PPE, their personal shield with them, or there will be something already there available for the teachers who move around? Or how will that work for the teachers that have to go to places where maybe they don't have the shields for them?
As I recall, when we ordered the PPE, the shields for teachers, we ordered enough shields for every single classroom in the district. And so every classroom should have one. You know, maybe.
Can they take it with them though, if they would want? Would they be able to say, okay, I'm going over here to this, I'll take it with me, or is that not an option for them? They want to know.
It's an option. I would just be careful with it because it's heavy and I wouldn't want it to come unglued, unfortunately, you know,
Okay.
but it is an option, yes, ma'am.
Okay.
Yes, ma'am. And we did, we also, you know, one of the things that I always do, Coach Craig would get mad at me, but one of the things that I always do is I always try to, you know, when we order, we try to order a little extra just in case. So I know we do have a surplus of a few at the warehouse.
That's easier, yeah, just have it there ready in the classroom for them.
If we're, you know, some are broken and we need to replace them.
Extras.
You know, again, I say this all the time to our team, our principals, you know, just holler at me, just email me, just call me, whatever, and I, you know, I will respond as soon as I can by the end of the day for sure, and we'll take care of it. Yes.
Sounds good.
diagnosticians have their own. Forgot about that. Some of the departments, when we first started with COVID-19, we started meeting with our directors of special ed, counseling, library services, all of those directors, and we asked, how many shields do we need? And so through our skilled maintenance department, we started building, individual plexiglass shields on little 1x2 frames. Came out really nice, and so we must have built how many, Jesse? About 600 of them ourselves. So that's quite a task for our guys. I mean, I would go back there and visit with them, and they were just little elf shops out there, just building these shields.
Last time I talked to you, I remember I had asked you about the special ed department. They had concerns about the changing station,
Yes.
where they would change the kids, and they were still waiting. Have they already been addressed? Has that been
Yes.
addressed? And
Yes, ma'am. Our team
Okay.
designed a really neat plexiglass that's mounted on the wall. That you want to elaborate a little bit, Ms. Susan?
Yes, I spoke to Ms. Della that's at Weslaco East, and she sent some very nice pictures and went on and on and on about how wonderful the maintenance department was, how they customized it. Mr. Garza and I met with all of the self-contained teachers prior to them returning to campus to find out what the needs of each child were and what special equipment they may need. Then what we did is Jesse and I went, Mr. Carrillo and I went to several campuses to ensure that their special needs were met, and it really went well. It was quite a project, and very well done.
Thank you.
Coach, thank you for all the hard work y'all are doing, and
Yes, sir.
your team and Dr. Canales. I know y'all have put a lot of time, a lot of effort, hours, and it doesn't go unnoticed. Principals, custodial staff, everybody.
Yep.
I know it's a team effort, and thank you for all the work that y'all are doing. Appreciate it.
Yes, sir. No, I appreciate that, sir. And one of the things that I can comment on is that this team and our superintendent and principals, we're all in this together, and we're trying our hardest to, navigate through this pandemic. And
Yes.
and one thing that I can say is that our staff works extremely hard to get things to where we need to be, where we want to be. It's not 100% safe or 100%, but I know that we are trying our hardest. Again, I commend our staff tremendously, our custodial, our maintenance, HVAC, teachers, bus drivers, everybody, our administrators, because it is a team effort. It is a team effort, and we're very blessed.
Yeah.
Yeah.
Thank you, Oscar. I agree with what Dr. Jaime says. We're here to look at what's going on and a better way to deal with it. And you know me about this. You point a finger this way, you better stop and look at where 3 other fingers are pointing back this way. So we're not here to point fingers. We're here to look for the best possible solutions as to how we can continue to deal with this thing in a more effective way to keep everybody at ease and comfortable with the situation, as comfortable as possible, because it's there and it's not going away. It's there, and it's something that we're going to deal with the best way that we can. And as Coach was talking about closures, I just wanted to touch on that. I believe, Dr. Canales, that a closure is based on a formula for the number of students that are present or staff at an individual campus. And campuses that are closed because of that formula that is used for the positive cases. And when those campuses close, they close for 5 days.
Okay, no, but I meant closure just for that 24-hour period, while they get the facility treated.
Yeah.
And
No,
that was it.
I'm not here to correct anything. I'm just sharing, just sharing that what is already in place, that campuses have been closed, and they close for 5 days. Dr. Canales, am I correct in what I'm saying, or?
Coach, yes, and our back-to-school action plan, we do have a COVID-19 condition level, and our level 5, which is, it goes from level 1 to level 5, is that we consider campus closures for 5 days per TA guidelines, 5 days, that exceed, or between 5 and 10% of occupancy with positive COVID cases.
What was that, 5 to 10%?
It's 5 to 10, right. COVID cases exceed 5 to 10% of occupancy in multiple, I'm sorry, that's district closure. Let me go to facilities. Level 4, I'm on the wrong one. Level 4, facility closure, COVID-19 cases exceed 5 to 10% of facility occupancy.
Okay.
That's level 4. Level 5 is district. You know, if we're across the district,
So.
so it's level 4.
It is in place, Coach, and I just brought that up so that we're all, you know,
Yes.
aware of that. And, but again, you know, nobody planned for this. We've done extremely well with the direction we've taken, and I don't think any of us can be more appreciative of all the hard work that everybody does. And we just ask that you continue to do your best, and that's all we can ask, to do our best. And, you know, we're not experts at dealing with this thing, but if we're going to make it through this thing, it's going to be based on how well we trust each other and how well we work together to overcome this challenge. And that's what the main purpose of this workshop is today. I mean, is there anything else that you'd like to add?
Yes, how about substitutes, Dr. Canales? I know there's obviously, we hear a lot of the information from the community. And, you know, when I know, and I have my daughter too, and I'm like Jackie, I'm ready to get my kids out of the house and get them back to a regular school setting as soon as we feel things are adequate for them. But when, I know there's times that they don't have classes going on, so when, obviously, if that was happening in a regular school year setting, security guard would be right there, you know, whatever, the teacher didn't get back, something happened. But in this case, there's times when nobody's notified and the kid is just sitting there staring in front of the computer, staring to the computer, and there's nothing going on. And nobody's being informed, and so there's a communication breakdown occurring as well. And, you know, I know it was happening early, almost like earlier today when there was we couldn't get these things going and this and that. I know things were happening, but I know it has happened. And what do we have in place to address those issues like that? Because when a teacher's not present in their classroom and they got 22, 24 kids staring, you know, sitting in front of a computer, there's a problem. And you know, and again, the more proactive we are, the less phone calls we'll get, the less we have to address.
So if a teacher's out, and Ms. Segura and Mrs. Janie Peña, who's also here, have done training for substitutes. We were up to 88 substitutes who've been trained. So I think part of your question, what I understand is, do we immediately call in a substitute if we know a teacher's out? How does a teacher notify the campus, I'm going to be out, so that we arrange for a sub? Because most of our kids, especially at the high schools and middle schools, they're going to be waiting online for the teacher. So the first question is, how do we arrange and make plans for subs, knowing that a teacher's going to be out? And then I added the piece about the training piece, that we've trained subs because it's a different type, even for a sub. You're coming into an environment where you may have a few students in your classroom, and you're going to have a whole bunch waiting for you on the screen. So an approach is a two-pronged question. So if a teacher is out, the substitute is still the same for arranging a substitute to help our campuses, correct?
Yes, you're correct. Thank you, Mr. Trevino, for asking that question. That's a very popular topic and one of the most difficult topics that we've had to address. I know that we're not alone in our region. In the state of Texas, everybody is having a problem with regards to substitutes. We have had three to four trainings. 4 trainings, I believe each training, we had maybe 40 participants in each training where we brought in our substitutes. We went over the back-to-school action plan, the safety protocols, the isolation protocols. We displayed for them all of the PPE that is available to them as well, because they will be in a classroom with students, what the teacher desk shield looks like, what type of supplies they can request, the mandatory face coverings, student shields, employee shields, everything that is available to them so that they understand we're not going to just throw you in there. We want you to be comfortable because you too, I'm sure that safety is a priority and a concern for them as well. So first of all, we want to make sure that they're comfortable coming in. So once we cover all of that, then we have Ms. Janie Benya and Julie Kelly, our instructional
That's Ms.
technology
Kelly,
facilitator, who take over the second half of the training, and they train them on the online platforms for kindergarten, pre-K, Seesaw, Clever,
Google Classroom, which is probably the most popular one. I do want to say, though, that like anything else, it is difficult for them to begin and this program and just take on a class, go in and take over. It's very difficult. Just like it was for our teachers back in March when they started learning about all the platforms and so on. So if we have a new substitute teacher going in, he or she may be having some issues to start the beginning of the day. And so, but we do have campus staff that will go in there to assist the person, especially if they're brand new at it. It has been a difficult process, to say the least, but I think that it's something we're working on and trying to improve.
I have a question because I know that sometimes even the school, the internet goes out, they can't reach the child at home. Is there any way that the children can have, is it allowable by TEA to have asynchronous instruction whenever there's an emergency, there's no teacher, there's no substitute? Can the children do asynchronous instruction for that day or hour or whatever
Yes.
it takes to get?
Yes, they can. As a matter of fact, we can have them do the asynchronous, the activities on their own, as long as the teacher has activities in the platform that they use, Google Classroom in this case. They should be able to. Another platform that we use is Screencaster, which they are able to view videos of the teacher. Sometimes the teachers will assign YouTube where they can go and watch videos of the particular lesson that they're learning. So can they do things on their own? Yes.
Okay. I remember when I was teaching, we always, in case something happened, we had our emergency lesson plans stored there in case something happened. So every teacher has that, I'm assuming, on Google Classroom or somewhere,
Yes.
something where they can go in and say, do this because no one's available. Okay.
Yes. It's been a long process, but yes, I think our teachers are experts now.
How many, and not to take, or were you done?
I'm done.
How many active subs do we have right now in the district?
I believe out of 232 substitutes, we've trained maybe 160, about 160. And one important note that I would like to mention is the majority of the substitute assignments that they're currently accepting right now are specifically to proctor, to supervise any student that might go in person. I believe that campuses are making arrangements to make sure that the actual lesson plans and any synchronous instruction is being done by a co-teacher within the grade level or the department or any additional staff, elective staff. But any time that we send out a substitute, we don't just send them out, with no technology skills or training. We do communicate. Actually, I speak to the majority of these principals every day with their substitute needs to let them know, I'm sending you help. They will be there as proctor for the student supervision. Make sure that you provide them with a paraprofessional or a staff member to go do rounds to make sure that they have the support. For the example, Ms. Ustaita, that you mentioned, if there's technology issues or if there's just issues with them getting on these online platforms, that they have adequate help so that our students are still continuing to receive high-quality instruction. So we do communicate with principals. They have done a fantastic job being able to cover these assignments. But I'm very happy that you requested this meeting and that you have advised us to look at alternative staffing schedules specifically for the individuals who have requested ADA. I know that that will help alleviate a lot of our substitute and teacher absent issues. So I thank you for that, and that's going to be tremendous help.
Ma'am, are we doing anything different? I know there's been scenarios where classrooms have had to double up. So when that's happening, why is that happening? You know, why is that if we do have this many subs active available?
Well, as I mentioned, we have substitutes who can do the physical supervision, the proctoring, but we still, with cases that are rising, aside from the traditional absences, you know, that occur, we have now competitions occurring. There's a larger number. We're always in need of subs. There's assignments that go, you know, unfilled daily, even in a regular school year. So right now, everything has doubled, you know, with the COVID situation. Yeah, and that has been the most important, I guess if you want to call it a deficiency. Not every substitute is able to do the online platform.
Ma'am, what about looking at Region 1? I know Region 1 offers a program, has a program in place for substitutes, and they'll send substitutes out to your district.
Yes, I'm familiar with SubHub from Region 1. I know that we have mentioned that in the past, Dr. Canales, I believe 2 to 3 years ago. A lot of our substitute pool, our applicants or our employees come from our community. Through Region 1 SubHub, they send substitutes that may live in other areas of the valley. And this is something that the board has stressed, that this is their way of giving those jobs back to people in our community who pay taxes and you know, who are products of Weslaco. And so that's a decision that has been made in the past, but definitely, if that's something that you would like for us to look at, we'll look at it.
That, and even look at the pay rate for a substitute. I don't know if we're, you know, I don't know if it's, how long ago, it's what's been the last time that a substitute increase has occurred. But, you know, just something to motivate the substitute to come in and give instruction to our students, you know, it's just food for thought there.
I agree, sir, and that's something we can definitely look at salary survey for our substitutes. I don't know if you want me to concentrate just in our Region 1 or if you want me to concentrate other areas.
No, Region 1, I think they have, unless they're running with a shortage, you know, I don't know right now, but I know they do offer a program.
So I can definitely look into that for you, and I can provide you the information in your update, your weekly update.
Yeah.
Okay.
And
What
is it-
about, I was just wondering, because, for example, like the Quest program, the reading strategist, people that we already have in the district that are certified teachers, I don't know if, because their programs are kind of on hold, would they be able to help out with classrooms or even to look into something where we use our manpower to help out in the schools with certified teachers that we already have?
That is a wonderful question, Mrs. Taita, and actually, I know you were not here during our budget process. That would explain a lot of what's, you know, happening today. But in balancing our budget, we actually had to cut 28 teacher positions. So 28 teacher positions went unfilled. And a lot of those programs, your GT Quest teachers, reading teachers, all of those that you just mentioned, filled those gaps. And so we have used every resource available to us to make sure that we're financially responsible in balancing our budget. And those are the drastic measures that we had to take.
And I think a couple of comments here on substitutes. I think every district is shortage in substitutes, Mr. Trevino, because I work in another district and there's shortage of subs right now because of the COVID. Another on the substitute pay, that's something we can address in the budget, every budget year. And we feel that we have to increase it. We can, depending on how much money we have available at that time for our budget. It depends on how much we receive this year because of our ADA through this COVID process. It depends what the TA is going to allow us this year, correct, Dr. Canales?
It's correct. Our ADA is going to be at the end of the year.
But those are good points. Good point.
Are teachers who, let's say they're sick, they're at home, they can teach from home even though they have to quarantine. Are they allowed to teach from home even though they're quarantining? Or do they have to call in and use their days, or how does that work?
So actually, I think Mr. De La Rosa mentioned that because of the transition waiver that was previously approved and the direction from the board at the time was that all decks on, all hands on deck, everybody was required to come in, so there was no remote working remotely from home. The only individuals, even today, that are allowed to continue working remotely from home is if they have been exposed or diagnosed, confirmed positive. Those are the only individuals that are allowed to go home and continue servicing students from home, but they have to go through this COVID leave request process with the risk management department.
Okay.
So as long as they bring back I tested positive and as long as they're able to feeling well enough also.
Yes.
Yeah.
And even going back, Mr. Trevino, you made a statement or a comment about testing. If an employee feels that they might have possibly been exposed and they were not, identified as a close contact, but they're adamant that they feel they might have been exposed, we have been very flexible and very understanding. We want to take every precaution. If you're one of those individuals that you feel, you're adamant, you may have possibly been exposed or you're exhibiting symptoms, all it takes is communicate that information to your principal, communicate with the risk management department, and right away they're sent home. Go home, go test. Make sure that you're okay. And as soon as they go home due to possible exposure or a confirmed case, then they're allowed to work from home.
Now, with that in mind, let's say, obviously they're at work, so they're getting exposure at work. With that in mind, do they go home? Are they able to, do they go home? Now, not especially a big family, especially a family like Jack, you got 4 or 5 kids, like we got 4 kids in my house. Now, not only am I worried about paying for my test, now I got to get everybody else tested because we were together the last 2 or 3 days. Is there anything there that we can do to help the staff, any school personnel or anything? Because I think there's a family that did run into something like that a month ago, maybe, a month and a half ago.
Okay. I'm going to allow Mr. De La Rosa to answer that because that's an insurance testing question.
Okay.
But thank you for raising that concern.
Sorry, Coach, was that your question?
Yes.
So anybody who wants to get tested, if they're an employee, it's covered at 100% by our insurance. So the provider just needs to take Blue Cross and Blue Shield, and it's covered. For individuals that don't have insurance for whatever reason, they can go to a testing location that we've identified 2 that have approached us. It's Dr. Stroman's office and Dr. Medrano's office. That will provide the testing for people who don't have insurance, but what they do is they'll charge it to the Family First Coronavirus Act, or the FFRCA. So if they don't have insurance, then they can go to those providers or any provider that will accept that.
So
to get tested.
no money out of pocket for them.
That's correct.
Okay, no, that's excellent.
Yeah.
I know this wasn't the first time. I know that was a concern that was brought up 2 months ago, where the same scenario, student tested positive, student goes home, and now the family's concerned. What do we do? And those are some of the guidelines that we would like in place. What should they do? Do I quarantine him? Do I quarantine the family? Do I, this brings up a lot of issues or concerns, more appropriate, more concerns than anything. And so that's great that you're informed, because now at least with having Dr. Stroman available and Dr. Medrano available, so they can all go there, and that's great, that's good.
And I do have an MOU that I'm looking at right now where a company will actually come in and offer testing to anybody, any students, parents, faculty members that want it on site. So hopefully we'll get through that and have it ready to go by the time we get back from the Christmas break.
Is that the rapid testing that I was asking you about the way other school districts like Harlingen and Progreso, it's different?
It's different.
It's a different rapid test.
Yes. The company actually comes in with a mobile van and will advertise it through the internet, the email. So they go in and sign up online, they'll get a QR code, and then they'll go to that van or kiosk, totally with no contact with anybody, scan the QR code with their phone. The company gives them the material, they walk off, and they actually swab themselves, put it back in the container, put it back in the drawer, and then they'll get the results within 15, 20 minutes via email.
Is it a grant also, or is it out of pocket for us?
It's going to be at no cost to the district. I mean, our insurance, we're self-funded, so yeah, we still pay for it just out of a different pot, if you will. But for students and who don't have insurance, it's going to be covered under the CARES Act. So there's no out-of-pocket cost to anybody.
So just for students, for example, my family, my kids don't have insurance, but they're students, so they'll be covered
Yes,
with under this.
correct.
Okay.
They'll be able to get the test at no cost to them.
That's nice.
Yeah, Ms. Sostak, Harlingen has it because it was a district that was selected by the state. There was 10 districts selected as a pilot program for right now, so that's why Harlingen has it. I believe in the near future, other districts can apply for it, and they'll have their rapid testing available. But for right now, since a couple of schools from Dallas districts, San Antonio, and Harlingen were the ones selected.
Do we have somebody, do we have anybody on staff that's all, that's constantly monitoring any type of those programs that are available?
Yes, we do. Ms. Kaufman is constantly looking as our head nurse, our district coordinator for health services, and Mr. DeRosa and his team are always looking for items too. And then we do have relationships with the city and with the county that they'll give us a heads up to. This may be coming, you may want to look at this, which is really important, that we have those contacts and that we're looking for ways to support not only, the children, the staff in school, but the families.
I was gonna ask, because I know, I was researching that and looking up different companies that are out there that offer services, because now you see that clinics, doctors have gone virtual, and you can have virtual screenings and whatnot. Is there any type of services that we can do like that, increase the amount of health services that we're offering at the campus? So not only rapid testing for COVID-19, but maybe additional strep, flu, et cetera, because I know there's rapid tests for a lot of different illnesses. And so that way, when parents get the call, especially now, when parents get the call, they need to come to school because their child has signs and symptoms, maybe we can kind of help them rest at ease because they've already seen somebody virtually or maybe got additional tests and they've identified the source of the illness or the symptoms.
Yeah, you're talking about it's called telemedicine, tell them.
I think they call it telemedicine. It's all virtual now. I know, like my doctor, we do it virtual now before I even have to go in, unless it's something else it's more physical they have to check. Is there services like that for families and students that we can bring on board onto the campus?
We don't have them in Weslaco ISD, but I do understand, and I could be incorrect, I'm looking at staff who monitors that there are some districts who do offer something like that.
Oh, okay.
So we'd have to explore, look at the pros and cons of it, and then, come to y'all with a recommendation.
Another question, Mr. La Rosa, is this program, is it just for people who are exhibiting symptoms, or is it also for asymptomatic people? Because obviously we know that the virus is being spread through asymptomatic people. So can anyone take this test, and is it weekly, biweekly? Is there a limit to how? I know other districts, they do it either weekly or biweekly or monthly. Can asymptomatic students and staff take this test?
As long as you're symptomatic or you've been potentially exposed.
So you can't be asymptomatic and take the test?
You can. That's what we do with our athletic programs. More than likely for insurance purposes will cover it, again, if you've been exposed or if you're symptomatic. But it's, if you just want to go get one just to go get one, more than likely your doctor's going to ask you and be insistent and say, well, have you been exposed, and kind of drill upon you that, and you say, well, I may have been. Okay, fine, and then they'll do it. But for insurance to pay for it, that's a requirement that, and that's just that's across the board. That's just not,
And I think with the grant, that's the thing with the grant, the TEA grant, is anybody can take that, no matter if you're have symptoms or not. And that, to me, as a parent, gives me peace of mind knowing, okay, my kid doesn't have symptoms, but who knows if she does or not, so.
The curative that I just mentioned, yes, anybody can go
Okay.
and get it,
good.
regardless if you're asymptomatic or not.
Okay.
What about, I know, since we have all the principals here and Dr. Canales, another big concern is failure rates. And, you know, I have 2 kids at home, and failure rate is a big one right now. I don't know, and I'm sure we'll sit down and talk about into more detail, but just to see what facts can be provided to us. I know it's a major concern right now because it's extreme, and having kids, you know, all summer long, get off the phone, get off the screen, and now it's get on the phone, get on the screen. You know, with what Jackie shared with the TEA guidelines, there's room for us to adjust there. I think it's impossible for us to sit here and hold our kids responsible to sit in front of a computer for 7 to 8 hours, 7.5 hours,
It's about
6.5
8 hours,
hours.
right?
And regardless if it's PE, whatever it may be, but it's still, it's very grueling on the teacher, on the student. So, you know, I think there's got to be other alternatives. I know I had mentioned to Dr. Gamboa early during the year on one of the Zoom meetings, you know, it's impossible. Obviously, we say everything is possible, but to cover the same amount of information during the first 6 weeks that we did last year, this year, it's a past example. How can we sit there and I was a teacher myself. How can we sit there and cover the same amount of material with no leniency? I mean, I know there's you're late, whatever, one day, but to me, that's just impossible to do, especially when everybody was first learning. I'm sure everybody's a little more comfortable now with online learning, but I think we need to look at other alternatives when it comes to making sure we're providing the excellent instruction to our kids, because what good does it do to have the kids come back to school, to a regular school setting, and they're behind? They're gonna be behind. There's no way.
Yeah,
there's no other way to say it. They're gonna be behind.
And you said it perfectly. I mean, a lot of the research is showing that failures are a problem, and they're going to be a problem across the state, across the nation.
Yes.
You know, we all know, and many of you are educators, so we know about the summer slide. You know, kids are on a high academically towards the end of the year. Summer, there's some learning loss, and then teachers spend a couple of weeks, maybe 3 weeks, maybe even up to 6 weeks trying to regain. So if you think about what's happened since March, right after spring break, we've kind of had like 3 summers. We had between March and June, right? Because we were not on campus for instruction. We had the regular summer, and now we have a fall. So there are tons of articles, there's research coming out about the impact. The research is saying that the setbacks are going to be greater in math than in reading, and they're looking primarily at math and reading. You know, more of a setback in math than reading, and that it's going to take some time to recover, you know, the losses that we've had. The Texas Education Agency has indicated that they will consider that, because they're still going to hold campuses and districts responsible for testing. And right now they're saying that we will be rated. Every campus, every district will be rated. However, when you look at CBA performance data and when you look at the failure rates, there are some concerns. There are some red areas. We code things. So we know that we've had increased failures at the campuses in most areas. There's some areas that are green. You know, what's happening that they're green. That means that there's less failures than there was last year. Not many, but there's some. We also take a look at the campus-based assessments, because TA, you know, we have the state curriculum. It's called y'all know what it's called, the Texas Central Knowledge and Skills. And TA still says that children have to show mastery of the state curriculum. You know, we can't pick and choose what we want to teach as educators. We have to follow the guidelines from the state. how we teach, the strategies, the pedagogy, the way we adapt to the online environment, that's our choice. It's a teacher choice. Your campus choice, a district choice, and the district improvement plan, and the campus SAIPs, which are improvement plans that we have to do every single year. So we are very concerned about failures. Mrs. Peterson, Mr. Aguilar, and I, we look at the failures. I know our principals do, and I know their teachers do, and saying, hey, what are we going to do about this? It's different. We have some kids that are disconnecting. They're like, I'm just going to, I'll catch up later. So that's something that we face. We do have 3 things, I think, that we've talked about that we've changed a little bit and tweaked, Mr. Aguilar. I don't have the notes on them right now, to increase engagement and still to stress the importance of an education to our children, because we all know that it is what helps give kids opportunities for life. And that's really, that's really important that we do that we engage them, that we keep them connected. It's not only failures, we're concerned about the health of the children who are away from, their normalcy, their friends, their teachers, their principals, and all the wonderful things that happen at a campus, in the classroom and outside the classroom. So we've got many things that we're going to have to deal with, Mr. Trevino, and to figure out how we catch up. We've had closed gaps. I mean, our reading scores and our math scores, our principals are here, the teachers have did a tremendous job. We have gone, last year we had all A's and B's. We were the only 6A school district in the Hidalgo County to have all campuses A's and B's. Our teachers have done tremendous things in creating a love for literacy and numeracy with students, and yet we had all those gains, and we know we're going to have the setback. Yes. And we have to have a plan. It's like, how are we going to address that? Not just now, what are we changing and tweaking? What have we learned from this couple of, now it's 3 weeks of school? Yes. And what does that mean for what we have to do differently now? But also, what does it mean for what we have to do differently when we eventually do happen? I hope it doesn't happen, I hope it happens sooner than, the end of the 2020 school year, when our students come back.
Yes.
So we're going to be very strategic about that. And then how do we motivate that passion for learning again in children?
It's a big task.
Who are getting tired of this. So, Mr. Aguilar, I don't know if you have anything to add. I know that you had some slides. I'm scared to open up the slides in case we have the problems that we had earlier. Yes. But I don't know if you have what we've talked about doing, what we've done so far to try to reduce the number of failures that we have.
Yes, ma'am. Thank you, Dr. Canales. Mr. Board President, Dr. Canales, members of the board, thank you. Very good questions that you've been asking. Thank you very much. Mr. Martinez, can you please go to slide number 33? And we did have some of this readily available to present, so I'm briefly going to try to answer some of the questions as best as you can. This is a collaborative effort with all our district. We have wonderful campus administrators, teachers, staff that have been working carefully. Ms. Peterson and I and the team, CNI team, have been working very carefully with this as well. Next slide, please, Mr. Martinez. So just to give you a little snapshot, what you see there, that was the average right before we left for Thanksgiving break. On the very bottom, you see a total of what we're averaging and the number of students per district. And I'm going to touch back because I wanted to go back on the questions that you had, Mr. Trevino, Ms. Ustaita, regarding certified teachers. And also you asked on the surveys. So I wanted to touch on that as well, to make sure that we address your questions on that. But I want to go and continue on this, and we'll go back to the student counts in just a bit. But next slide. So we wanted to pull in some of the research that we have there, and very good point that you shared regarding the failure rates, because that is a huge concern for us as well as every district that we're dealing with, that are dealing with this right now. So TA, in collaboration with NWA, the Northwestern Evaluation Association, it's a big global research company that puts in a lot of data. As Dr. Canales was alluding to, we're looking at 3 different scenarios. We had the slide in the spring. We always anticipate the slide in the summer. And now we have the slide coming into the fall, which is of great concern and is something that we've been looking at. Next slide. So what you have here is some of the data that they collaborated with the NWA research. And TA shared this with us earlier. Now, what they have predicted here, the forecast was with the reading and with the math. And what they forecasted was on the slide for COVID and the slide for the summer loss. So as you can see that data that you have in front of you, You see where it's the COVID, and then you see the decline where it drops when it comes with the COVID slide. So we understand and we know we were anticipating these concerns. Next slide. So what they're forecasting, and this is the data that we do see, the greatest decline is going to be in the mathematics. And that's based on the research that we have moving forward, where they're going to see more. And a lot of that is based on the foundational skills, and it's built upon when they're learning. And if they haven't been taught those skills, they're going to struggle. Versus reading, if they already know how to read, they have some of that prior knowledge, they're going to continue building on that. Next slide. So here, some recommendations from the research, and this is very common, you're going to see it across, but I want us to look at the second one. To guide curriculum and instruction to support students, educators will need data. So one thing that we do as a district, we're very data-driven. We look at that very carefully, and that's going to direct our instruction, that's going to direct our planning, that's going to direct how we move forward. Next slide. So what we're looking at here, and these were the 3 points that Dr. Canales was alluding to. We do follow our TEACS resource system, which is our curriculum that we follow. This is our flagship, and we're still obligated to make sure that we follow our curriculum and teach all the student expectations because we're being held accountable. Our students are expected to perform at the state assessments. But one of the key, some of the key strategies that we're looking at, to put it in a nutshell, we can't cut too much because if we do, then we're going to take out a lot of our substance from our instruction. So we have to be very careful, and this is a lot of discussion that we've had with our administrators, we've had with our teacher core groups, our PLCs, our instructional strategists, and CNI. And what we're looking at, number one, we have to have flexible implementation. And that's adjusting the curriculum to meet the needs of the students and the teachers. Online and teacher-led components, as you mentioned, Mr. Trevino, we got to find a better way, and we're looking at those options. Online, number two, online instructional support for teachers. We're continuing to look at, see how we can better impact instruction. And number three, we go back to the data. We're looking at the data. So we have formative assessments to check for understanding, to give immediate feedback, and also the data-driven decision-making. So we're constantly looking at all the information moving forward. Next slide, Mr. Martinez.
Mr. Aguilar, I had a question.
Yes,
because of the online instruction. I know I guess, depending on what grade level, they have certain minutes, daily minutes to meet. Is it the same across the district? Let's say pre-K. Are they all teaching the same amount of minutes, or does it vary by campus? How is that working? Because I've had concerns where teachers are saying, we're teaching more than this school, or, just, is it the same across the district?
So that's a very good question. So when we came back at the beginning, we had to submit an attestation plan. That attestation plan had to be board approved and TA approved. And that we do have it available here. It's quite lengthy. And that was a collaborative effort with all our administrators, campus administration, teachers, DAC. We had a large group working on that, as well as our instructional schedules. So those instructional schedules are there. If there's been some deviation on there, then that's something that we have to go revisit on the campus. But we do have our instructional schedules for elementary, middle school, and high school there. Okay. So this is our board-approved attestation. And of course, that's just a snippet. On the bottom, there's the link, and it's quite lengthy, but it took quite a bit of work, quite a bit of collaboration, quite a bit of input, and we all discussed it back and forth even before we took it to our Board of Trustees for approval, even before we submitted it to TA. There was a lot of collaboration and discussion with this plan. So again, if there's any offset instructional minutes, that's something that we can look at, and definitely if there's a concern, we'll sit down and we'll discuss that with our campus administrators and see what's going on, but we do have schedules in place for that.
That includes the time that they start in the morning and the time that they end in the afternoon. All middle schools are starting at the same time, ending at the same time?
Yes, and that's a very good question because we are obligated, and it goes back to what we were talking earlier, and I wanted to mention that we have to fulfill, and this is what every district has to fulfill. By the end of the year, we have to fulfill 75,600 instructional minutes. Mm-hmm. How we work that with our instruction, that's up to every school district and how they're going to work it out. So we have our start time for elementary, for middle, and for high, and we have to calculate based on the board-approved calendar to make sure that we have those appropriate those minutes available, and that we make sure that we attain those minutes, because that is mandated by law.
Okay, and to clarify some questions that some teachers have brought up to me, breakfast is not included in instructional time, neither is recess or anything like that. It does not include it in the start time of school.
So our start time, to give you an idea for our start times, we start at 7:45 for elementary. Okay, for middle schools, we start at 7:35, and for high schools, we start at 8 o'clock. Am I correct, principals?
Okay.
8 o'clock. So within, they're starting with their breakfast that they have everything. That's when our classes start. So that's when our instructional minutes begin until we end in the afternoon.
So middle school starts, to clarify, because I know that some people ask me, 7:35 middle school, and that's when breakfast starts also, 7:35, because I had some screenshots of 7:15 is breakfast, starting instruction at 7:20, 7:35, something like that. So it has to be across the district. 7:35 is the start time for middle school.
So I want to make sure we don't give you any misinformation on that. Principals, can you clarify that on the instructional start time? I know we have 7:35.
That includes starting breakfast at 7:35.
Yes.
Okay.
Just want to make sure
Want
I
to
give you
clarify
accurate
that.
information.
And-
Okay.
Yeah, and for on-campus instruction, the law also, the TA guidance for the 75-600, if you're on-campus instruction, it starts when the first bell rings, and that can include, and it includes lunch, and if you have recess and other things, so it's like from bell to bell, beginning bell to end bell.
Okay.
75-600 minutes are
Okay.
required. And
Because
we have to
there are
watch.
different schedules for middle school that I was given.
Yeah.
So just, that's
So-
something we can address, I guess.
Okay.
Yeah, we'll definitely look at those. We
Now,
can
the
look at those.
75,000 minutes of instructional time, that has not been modified as of yet, as of this point right now?
That is correct, sir.
Okay.
We're still mandated to make sure that we cover the 75,600.
Right. And we have more time than that. Through the DAC subcommittee from the District Advisory Committee, Mrs. Peterson has helped out with that for a number of years and done a great job, where we look at the calendars, like the campus's proposed calendars, they bring it to committees, we take a look at them, and then we decide. But it's something we may have to consider for next year. We do run long days, 8-hour days, and we usually get released earlier at the end of the year. And if this COVID-19 continues, and we have to be out through days, if we have shorter days, school days, school days, then we may have to extend the calendar, until early June. So we'll start that process in January again, taking a look at all that and the implications of COVID-19, what it's taught us and what it means for our calendar. But right now, we have the 75,600 minutes plus. We also had to look at the 2 days that I mentioned, September 28th and 29th, where we didn't have children in school, and make sure that we had the time there. And we looked at that before we went to the board with the transition plan. We did have the time.
No, that would be excellent, Dr. Canales, even if we have to go, a few extra weeks there into early June, but lessening, or I think that would take some of the burden off the students and allow them more time to rejuvenate and because it's and the teachers, this thing has been gruesome on everyone.
Right.
And I know we just came back from a vacation, but it's
And I think that's the purpose of meeting today, Coach, what we had said, because it is after Thanksgiving. We're kind of expecting the cases to rise within the next
and then in
weekend or
Christmas,
two.
and then in Christmas,
So
yeah.
with that, I'm not saying let's go on vacation at all, but is that an option where obviously the school district can rearrange the academic calendar to whatever we need to do, adding weeks to June? If
Yeah.
we know after Thanksgiving they've been around people, after Christmas they've been around, is that something we can rearrange?
Yes, other districts have rearranged their calendar. So, an example, some started 2 weeks later. The board, we took action on August the 2nd, I think it was August the 2nd, to rearrange the year instead of starting August 24th, to wait until August 31st. I know other districts that have said, okay, we're going to take a week off. You have to add the week. What I don't know is how it applies to the teacher calendars, the work calendars. The contracts, it's been approved, because our teachers still work 187 days. So we'd have to consider all that factors, so we can look at it and look at the contracts and see what obstacles, because, the pros and cons of possibly doing that. The other option, which you mentioned earlier, in the direction that you gave us, is to look for alternative schedules for teachers. And maybe that's one thing that we can do. Like, we know just taking the winter break, the Christmas break, we know we're going to come back. People are going to want to be with people miss their families too, are going to want to be with families, so we can look for some options for the first 2 weeks when we come back. What can we do and maybe stagger staff then? I mean, we're open. We're in this together, and we're in it to win it for children and for staff, and as long as we, explore things that are allowed by Texas Education Agency, that are recommended by the CDC and health officials, and don't violate any UIL rules or, any laws or House bills, we can work within those parameters and come up with some good, viable options with pros and cons. Every option is going to have it's going to have pros and cons, Yeah.
Yes. Now, we appreciate it, Dr. Canales, and we gotta act, we gotta be aggressive on this, because it's, I'm sure Dr. Rodriguez will agree, the spikes are gonna continue. It's probably only gonna get worse now, because there's gonna be people with regular flu symptoms being diagnosed as COVID, or COVID people being diagnosed. I mean, it's gonna cause a lot more concerns here in the near future. And, obviously, luckily, the flu season hasn't hit us yet, but, it's going to be hard to tell one from the other until you get tested. Another, for me here, another thing that came to my mind was, is there any way to encourage staff to get tested as well prior to, I know we started today, but, I know for voting, they allow staff to go off the campus to go vote or whatever. I don't know if we can allow teachers to go off of campus or to go get tested, come back, just so everybody has that reassurance. I don't know if there's a way to Mr. Perez, I don't know if there's a way to.
I know we're going to be going into a closed session because that's a legal question, and we could talk about it in there.
That it?
Well, I wanted to just touch a couple of points right there real quick to answer a couple of your questions that you had. So if we can go to slide 43, Mr. Martinez. Slide 43.
Are you looking at for the failures?
Yes.
Okay. Is it not being pulled up?
You have the slides in front of you? Okay, I can go ahead and, there we go. He's got them up. Okay, so just to share with you, we are looking at this. We've been looking at this very closely, because I know you mentioned it, Mr. Trevino, regarding the failures. So what you have up there, and we didn't put all the schools up there because it would be quite lengthy on the slides, but just to give you an idea of what we're comparing here. We're looking at academic data with 2+ failures in the core content areas for high school, middle school, and elementary schools. So if we're looking the first column, and then you have one to the right. And if we're looking at this, we're looking at 2021 failed two or more core content subjects versus how many we have enrolled for the school year. So if we're looking, for example, let's look at Weslaco High School, 9th grade. Now, keep in mind, this is a transitional year as well, so it is a concern, and this is something that everyone is dealing with, everywhere. So what we're looking at is not specific just to a concern on the campus. But if we're looking at that, we have 801 students enrolled. When we gathered our data, we had 208 students that were failing 2 or more content areas. Compared to last year, we had, the count was 87, which was 121. So we see an increase of 26%. So you start seeing that increase through different campuses. Next slide, Mr. Martinez. So here you see the middle school. So we see the concerns that we're dealing with the core content areas. Next slide. So this is constant throughout. So next slide. So this is something that we've been working very closely with our school principals, and they are constantly having those discussions with us, their campus facilitators, teachers, PLCs, instructional strategists. This is our core, and this is something that they presented to our district advisory committee, and this is what they do consistently through their PLCs. So that's our core group there. Next slide. I'm not going to go through all the slides, but just to give you an idea, we have we're very big on data. We break down our data, and we look at what are the GLOWs, what are the GROWs, what are the recommendations, what do we have to keep in mind, and what can we do to continue supporting you. Because we need to make sure that we address our student needs and continue refining our practices to improve instruction. Next slide. So you see consistently, you see this with the different subject areas. For example, this is secondary math with Mrs. Nora Lopez. Same thing, she's providing the recommendations, the GLOWs and the GROWs where we need to pinpoint. Next slide. We're looking here with our elementary reading and writing with Ms. Arcadia Longoria, same thing. You see the data, we're comparing last year to this year. We're looking at our performance levels for approaches, meets, and masters. We're looking at the data that we have. Next slide. So you can go through a couple of slides, Mr. Martinez. Just scroll down. Just to give you an idea, we do have a lot of these discussions. A lot of this does take place with our teachers and their PLCs. And then from there, I wanted to jump over before turn it over into some of the ramifications of state funding. I wanted to address a question. If we can go to slide 25, please.
So these questions are about the surveys, correct?
Correct.
The
The first one is a certified teacher on the 25.
Okay.
Okay, so I know there was a question on
And
that.
then Board of Trustees, if you have questions about funding implications and all that, we've got other slides, and we have other team members here that can share information.
Okay. Slide 25, go to the next one, please. So right here, regarding, this is a challenge that all school districts are dealing with right now when we're looking at on-campus instruction, because we're mandated by law to make sure that every parent that chooses to send their child to school has that right to do so, and we're constantly looking at that student ratio to maintain that safety in our environments. So when we're looking at this, and this is something that Dr. Canales mentioned earlier, that we're going to provide the pros and the cons when we're looking at an alternative plan to say, these are some options that we have that we've been discussing. But one of the things, I know the questions come up regarding the certified teacher, because you mentioned it earlier, Mr. Trevino, and I know Mrs. Taita, you also mentioned it as well regarding the certified teacher. So when there's a certified teacher is not in the classroom, what TA is doing in order to make sure that we still generate funding is they're allowing us to have on-campus instruction with individuals that have the capacity and expertise. So if we do not have a certified teacher in there, that's either going to fall on our paraprofessionals or that's going to fall on our substitutes. And they're very specific with the language, the capacity and expertise to provide academic support specific to the student's grade level and content area. So that's something that we're constantly looking at to say, how are we going to work this in order, because we still have to provide on-campus instruction physically with staff on there. And we have to make sure we follow that language accordingly.
Now, Mr. Aguilar, when we have paraprofessionals teaching it in the classes, do they, I don't know what their rate is compared to a substitute, I'm not aware of that, but now we're asking a para to act like a full-fledged teacher and lesson plans and so forth, grading, especially some that have been there, you know, for 2, 3, 4 weeks at a time. Is there any way to increase their pay during that time or anything to compensate them during that time? But again, I don't know if it's, and I probably should have done my homework to compare the substitute pay to their pay, but anytime they're sitting there being put into a, you know, where you're having to teach 22, 25 on a consistent basis online, you know, and I'm sure it's got to be a a tough task for them.
That is correct, Mr. Trevino, and that's something that we look at. Now, the intent for our paraprofessionals, now some do go above and beyond, and they all work very hard. You know, we have to, give kudos to all our staff.
Correct.
What they've been doing. But some of them do want to take it to another level when it comes to instruction, so they do a lot of it on their own on what they try to do. But for the most part here is those lessons, as Mrs. Saito mentioned earlier, those lessons are prepared by their teachers. And their teachers are there, and our paraprofessionals, yes, they're in local parentis per se, there for the teacher, but they're there to use that as a guide, what they're teaching and proctoring in the classroom on there. So that's one of the things that we're juggling. So I know when we're looking at several other districts, because we've also have explored that option, it's a matter of looking to say, when we do meet and provide, alternate options, we're going to look at all the pros and the cons. But we're always looking at everything to make sure, one, are we providing that on-campus instruction? And two, our numbers are increasing with students. So if I go back, we had days up to where we had 1,700 kids in our schools. So we still have to supervise our students, and we still have to provide that on-campus instruction. So that is something that is constantly being discussed at all campuses. Some campuses, and we do have some information there. I know Ms. Segura did some homework on that as well, seeing what other districts are doing specifically, how they're using their staff, who's providing the on-campus instruction, and how we're making sure that we follow through with the recommendations and ensure that we don't also put our district in jeopardy when it comes to funding.
Okay.
So I wanted to share that with you. Now, are any questions on this regarding the on-campus instruction and the certification?
Do you have numbers of how many kids are actually on campus, on every campus? On
Yes,
these
ma'am.
slides?
If we can go back to slide 33, Mr. Martinez. We actually do. Go to slide 30, I believe it's slide 34. That one right there.
We have the we have early November, we have the link too.
Yes, we also, so this is just a snippet right there, but if, Mr. Martinez, can you click on the link, please, to the right? This was right, that snippet that you have is right before the week of Thanksgiving. So we're just going to give you an idea of what we had today. And I know Dr. Canales mentioned it, she hit it right on the point. We had 1,299 students, and this tally is taken every day. We do call our campus administrators, and they have identified staff that gives us the updated numbers. Go to the tab on the bottom there you go, for today. So today's count, that's the numbers that we have, 1,299. So you have the counts by high school, middle school, and elementary, as Mr. Martinez scrolls up. Now, this is the first day back, so we did see about 100 less students, but as we're moving along, those numbers are going to increase. So our highest number right before Thanksgiving was about 1,700, just to give you an idea on what we're looking at. So we're still, we want to make sure that we keep our numbers in a setting where they are going to be safe. Okay, so that's something that we're going to be looking at alternate plans. We have to look at the pros and the cons, because we don't want to increase numbers too high, because then that will be a concern as well. So we want to look at our numbers, and we're projecting and we continue forecasting on what we're going to be looking at. Now, we do take our surveys with parents. We have another one that's going to be required that we do before our next grading period, which the third 6 weeks ends on December 17th, and we're going to launch that out hopefully by next week. And we're also going to ask our parents what their preference is for their child. So that'll give us a better indicator where we're at moving forward.
For the fourth 6 weeks. So,
That is correct.
So every prior to the next grading period, I'm going to call it grading period.
Yes,
Prior to
ma'am.
the next grading period, we survey parents about on-campus versus remote.
So these counts that we have in front of you, we have them from September. So they've been here for 2 months that we've been taking daily counts of our students. From the beginning, we had the teacher volunteers, those that volunteered, and staff, and we had those counts as well from the beginning, moving forward. But once the transition ended and everyone came back, then we just continued with our student counts.
And Dr. Canales, you probably can provide those updated counts on our weekly update?
Yes.
On Fridays, so that way everybody knows how many students are attending campuses?
Yes, sir.
Yes, sir. We can provide that.
So any questions on the counts or regarding teacher certification or on-campus instruction? I just wanted to touch, I know you had a question on the surveys, and I just wanted to touch on that, Mrs. Taylor.
Yes, no,
Okay.
I was able to see.
So let me go ahead and jump to slide 60.
So we have several other areas that we can discuss, boards of trustees, or if you prefer, if you just want to ask questions, additional questions, and if
No,
we have
I-
slides, we can share them, but we can also, like Mr. Nieto said, put this information in the Friday board update, if that is what you would like us to do. We prepared more slides probably than what we need. We have surveyed before. We want to survey. You brought the thing about safety and feedback, again, do we have everything in place before the break, soon too, with staff, like we had a teacher and staff survey before, and they gave us some feedback on things that we could put into place. But I think it goes back to, what's important, we want to put things in place, and we want to make sure that we provide the resources so that it's not only on the paper like a playbook, but it's also you're able to run it. So that's important. So it's whatever you all would like. We can go on with the presentation, or we can just take
No, I
more
think-
questions and go through it.
I think things have gone great, just question and answer, and so, you guys have done a tremendous job with these slides. A lot of
Thank you.
information. We can review a lot of these slides ourselves as well.
Okay.
No, I think, I don't know if any staff members or any principals would like to comment on anything or anything, please feel free. This is, obviously, we're all trying to get on the same page together. If anybody wants to step forward and any concerns or anything, please feel free.
I won't make it long. Good evening, board members, Dr. Canales. My name is Rosa Garcia. I am the principal at Justice Raul Gonzalez Elementary. And I just want to assure all of you, sitting here, I'm going to be very honest, I felt a little incompetent. I'm not going to cry, but to say, point, maybe I wasn't doing my job. And we have spent endless hours ensuring that at least my campus, and I know I can speak for my colleagues because we talk to each other all the time about what we're doing, how we're ensuring. There is no safe, I cannot guarantee that every single staff member will be safe, will not contact COVID, but I can tell you that we come in every day to ensure that we're doing our best to make sure that everyone's safe. What I tell my staff is, you take care of you, and that takes care of everybody else. If I take care of me, I automatically take care of you. And, that is one thing that I preach. I give the example of my brother's an RT. He's a respiratory therapist. And just today, he texted, what is going on? I said, I have a meeting tonight. What about? I said, well, we're going to discuss protocols. And he says, okay, just tell your teachers that I'm up to 40 COVID cases. He's a respiratory therapist. This is what he does day in and day out. And he says, tell them I have yet to get sick. My family has yet to get sick. He was down this week with us the whole week. He says, take care of yourself. Take care of yourself. And I think that's just something we need to embed in our teachers' heads, in the adults' heads. I know with my staff, we looked at the dashboard and we talked about what observations can we make. 3 kids, 3 students have COVID. I said, what other observations do you notice? 10 adults, 10 staff members. And I said, and look, this is us. I am tasked with the responsibility of telling kids, you need to stay safe, keep 6 feet away, wear your mask, put on your shield, you can't get close to each other. I said, this is us, the adults, yet we're the ones bringing COVID in sometimes. So let's take care of each other. I know I speak on behalf of my colleagues. trust us. We do not want anyone getting COVID under our shift. I can guarantee you that. So we come in every day making sure that we do the best that we can. Were the teacher shields falling apart? I think I was the first one to send Mr. Aguilar a picture of my shields. But I also had a paraprofessional the very next day come with Gorilla Tape and secure those shields. We're proactive. Like, we're not gonna wait for the vendor to come. So, it's little things. I just wanna say, trust us. Trust us when we say we want the best for each, not just our staff, but our kids. And my biggest concern right now, I do wanna tell you, are the students. My priority have always been students. Anybody who knows me, Ms. Ustaita worked at Sam Houston when I was there. We worked together. I never say she worked for me. We worked together. My drive were kids. So right now, that is my concern. So I'm kind of glad, Mr. Trevino, that you brought up the failure rate, because I have worked so hard at my current campus to get us where we are. And this whole COVID thing just set us back a little, but we're trudging through. And that is my drive. Kids, success. Success for all students. How can we do that? I need to be there. Teachers need to be there. And we're gonna do the best that we can. We have anywhere from 1 to 5 kids in each class. It's not crowded, So, there are so many things, but I just wanna end with this. I invite each one of you to come to my campus. I invite you to come. Come as a group, and then you can see how we follow procedures, and you can see what we do every day. So I welcome you, but I do want to leave with that and just say, we have lost sleep, keeping the school the best, the safest that we can for everyone. So we do care about everybody, and we do want everybody to know that whatever it takes, we're going to do. But we also need adults to be there for the students. Thank you.
No, thank you, Ms. Garcia.
Thank you.
Thank you very much. Miss, our intent for today's meeting is just so that we can all get on the same page. It's not to say, hey, they're not doing their job, nobody, no. We all need to, the only way we're gonna do this is together. So we appreciate you coming forward and voicing your concern and your, but this is, our intent here is obviously knowledge is power, and the only way we're all going to combat this together is by doing something like this. So thank you guys for being here. Is there any other principals?
I just want to add, I know Ms. Garcia, I worked with her and Mr. Aguilar, and they're awesome. I know that they care about the staff and the kids. That's never, ever been a doubt. That you work hard all the time. I was there, I saw it. Today we just brought this up because it wasn't my concern, it was people's concerns in the community that approached us. Hey, can you ask this? Can you say this? Can you clarify this for me? So I don't want you to feel like, hey, we're telling you you're not doing your job. Not at all. I know, I worked with you. I know you do your job to the best, all the principals, to the best of your abilities. You're great, you're awesome. Let's say Weslaco, like Dr. Canales said, we're the only 6A district with A's and B's. You do an awesome job. We just wanted to do this, like Mr. Trevino said, because these are the concerns that were brought up by the community, and we're the representatives, we're the voice, and we just want to clarify, because they're watching right now, and they're looking, and they're listening to everything we're saying, so it's to clarify it for them also.
I just want to say that, our teachers, our staff, they're all essential. When you talk about essential workers, we need to be there for our students, for our parents, for our community. They need us. They need us. And y'all are doing a great job. Great job.
Thank you for the comments. And I just wanted to add to that, and I can speak for all our staff here and our principals, and thank you for the comments and the kind words. Appreciate that. We also want to be transparent. We do want to make sure that we're out there. So anytime you have any questions or anything that you need clarity with, we're always, anytime we pick up the phone, anytime we're always communicating with each other, that's our goal, is to be transparent. Now, could there be a miscommunication here and there? Yeah, it happens. We're human and it happens. But by no means are we trying to hide anything or anything like that. We want to be open up with everyone, and anytime you have any questions, feel free to reach out. You know, we're here to work together because our best interest, as Ms. Garcia mentioned, and everyone talks about, is our students and our staff. You know, we want to make sure that they're safe, and we want to make sure that we continue educating and moving forward. And I know that's everyone's drive, you know, beginning with the vision from our superintendent, our board, moving forward, and providing us with the tools that we need, then we'll get the job done, because we got great people around us.
Right, and then we also, for staff, you know, one of our board policies that I really, really love is that if you're having situations and you have concerns, go to the campus principal, go to the department head. You know, and I know I've heard conversations, people are afraid to ask questions because they're afraid people are going to say, oh, it's just that person. But we're not about that, and that's not the time that we're in. We're about being together, and if there's a weakness somewhere, I know that our principals, our strategists, we'll figure it out. We'll get together and figure it out. You know, we've given up summers, we've given up spring breaks, you know, we will do it. We're available, you know, in the weekends, you know, chatting, you know, with each other and talking. So I want to encourage, you know, when staff does calls and they have concerns, you know, please, the lowest possible levels where we're going to get together, work together and collaborate to solve problems and to create opportunities. So, you know, to the staff members that are calling you, you know, I ask for that. And if there's any fear, I don't want to talk to this supervisor, I don't want to talk to that person, you know, try it. Try it. We're in this together.
I would like to just make sure that, you know, we're opening up our campuses, obviously with precautions.
Yes.
But I would like to see our central office opened up as well. I think if we're making a statement that, hey, we're going to move forward and because, you know, obviously before I was sitting in this chair, I'd go to the administration office and sometimes it feels like it's not as welcoming as it used to be. And I think that needs to change. I think if we're gonna open up our campuses and expect our teachers to be out there, not just teachers, our school personnel. I know we've had school personnel since July, early July.
Right.
If we're gonna open campuses up, I think and I would even like to see, and I'm gonna take you up on that, ma'am. I had told Dr. Canales on my second day, whenever that I plan to visit campuses and just to visit and be visible out there and just, you know, be visible. But I would like to see our administration office, our office personnel at their campuses helping out as well. The more hands we have out there, the better.
Yeah, we agree.
So,
Yeah, thank you, Mr. Freya.
yes.
I just want to make a comment, ma'am, that I also agree with what the comments everybody else is saying, that we need to realize that everyone working in education is dealing with the unknown, something that they've never seen before, and dealing with new policies, protocols, procedures, equipment, et cetera, new needs and gaps. And everyone at the campus level, this, like everyone was saying before, this is just for clarification. And I am very proud of the job that everyone is doing. I know that everyone within every single school district is working around the clock, weekends, like you said, summers, vacations, all those, there was no time, they were working around the clock, even off contract. So, you know, and I commend you and especially all the staff as well, all the instructional staff and everyone that support staff and all the different departments. I understand that we're talking about grades, there's a lot of different variables that teachers can't control that they're dealing with as well when they're delivering instruction virtually. They're also dealing with, in a sense, classroom management is virtual management as well. And sometimes there's support at home and sometimes due to situations there isn't. So we understand that, and people need to understand that that's also going to create a slide. It's not that when we start looking at data and looking at drops as far as academic performance, it's not solely because of the instruction, it's not because of the delivery or the method or mode that they're using, it's also because of the new variables as far as virtual management and keeping kids engaged. And instead, people need to understand also being in the classroom, kids used to focus on the instructor, especially when the instructor was up there doing the lesson, delivering the lecture. Now kids are looking at a screen such as the one we are looking at, and they're seeing all their classmates. So the distractions and there's so many variables. But I just want to say that you all are doing an exceptional job, especially all the different departments, maintenance, transportation, nutrition. I mean, everyone is doing an exceptional job, and we're continuing to adapt. And like as new board members, and even the current board as well too, I think we're all going to continue to support everyone 100%.
Thank you.
Thank you, Mr. De Los Santos, for those words, and you're absolutely correct with all those variables. And I think what keeps us all up at night is that engagement piece. I think, and one thing that we covered with our principals and our staff was we went back and we said, what's within our circle of control? Because when we have our students on campus or staff, there's a lot that we can control for instruction. And right now, that is something that everyone's struggling with, is like what you're saying right now, those variables. And we take all that into consideration, and we constantly have those discussions moving forward. But thank you for pointing that out. Any other questions regarding we have more information, but you let us know if you want more specifics. We do have some feedback from surveys and so forth, so just let me know.
Yeah, good. So
Thank
y'all
you,
can
Mr.
review it
Aguilar.
if you have questions, so,
Dr. Canales?
yes.
Anything else, guys? Okay, again, thank you all for your patience and sitting there and being a part of something very important to everyone. We will now go to item 4. We'll go into closed session. The time now is 8:58. And we'll go into deliberation regarding COVID-19 matters that involve personnel, students, and/or consultation with legal counsel by Government Code 8551.074, 551.0821, 551.071. We will now go into closed session.
8:58.
Out of closed session, the time is 11:05, and I call this workshop adjourned. Okay.
Yes, sir.
Done.
All right, gentlemen, you have a good evening. Sure.